Okay, everyone. So over the past couple of years, obviously, we faced a lot of risk and uncertainty. I don't think the Institute for Risk and Uncertainty was prepared whatsoever. The world turned upside down and we haven't met up for the past couple of years. So I'm really delighted to have you all here today to showcase our research at the Institute and also to relish in the accomplishments of all of you and hear what you've been up to in your latest works and kind of pushing the boundaries of science and research. So really excited to be able to run the Risk Institute annual showcase for 2022. So we'll be running until around 1:30 p.m. And hoping to stage a bit of a memorable occasion. And then after the session, which is running till around 1:30, we'll go to the Pen Factory for lunch at 2 p.m.
Francis, we're recording?
We are recording, correct.
They can hear you?
They can hear me. So, health and safety wise, just make sure you're wearing your masks while the presentation is going on. The speaker is able to take off their mask, and presumably everyone here knows what the fire exits are. You've been going for a long time, right? So the agenda for today is going to cover a few topics, from sampling methods for uncertainty quantification, estimation of space-time data with GPD distributions, creedal networks, interval uncertainty and logistic regression, drug-to-drug interactions and COVID-19 impacts, interval-based sensitivity analysis, stochastic updating of vibrational systems, and coupling of subchannel analysis tools. So without further ado, I'd like to introduce Alpida to the stage to give her presentation. Let me just get your slide up. And full screen. Do you know how to get that to full screen?
If you left click at the bottom, Francis, I think you can go to presentation.
Left click at the bottom.
Just left click on the slide.
If you go to view, probably.
Full screen mode. Okay, there you go. Oh, sorry, one last thing before I feel like I had another slide there. But so you all have a sheet of paper in front of you, and the winner will get £1,000 towards their research budget. So if you can put your top choice of the favorite talk, and then your second choice for the favorite talk, will count together the points at the end and grant the speaker £1,000 towards their research budget. Now, maybe you can find a loophole to be able to go on a trip somewhere, or if you create a research proposal to investigate whether money actually buys you happiness, maybe you'll be able to spend the money whatever you want. But yeah, so just fill out the forms at the end and we'll count it up. Thank you.
Can I use just the keyboard to take slides? Okay.
Absolutely.
Hi, everyone. It's not so nice seeing you in person after such a long time. For those of you who don't know me, I'm Alpida. I'm a fourth-year PhD student now, affiliated with the Risk Institute. I'm a pharmacist by training, and I'm supervised by Professor Maskell from electrical engineering and Professor Serbi Mohammed from pharmacology. I'm also funded by AstraZeneca and EPSRC through Risk Institute. And yeah, well, today I'm going to present to you some work that I've done as part of my PhD student that has also resulted in a recent journal publication of scientific data. And for those of you who are not aware with a specific journal, it basically promotes the generation of scientific data sets that can be findable, accessible, interoperable, and reusable based on the FAIR principles for data sets. And yeah, basically this data set that I'm going to talk to you about aims to promote research in signal detection for drug-drug interactions.
Alpida, sorry, we can't see your slides. I think the sharing is sharing the PowerPoint of the agenda. Sorry, Alpida.
Okay, thanks for speaking.
That's my mistake. We changed
the screen, Francis. Top left.
Okay, perfect. Can you now see it okay?
Yeah, signal detection in pharmacovigilance.
Right.
Okay, perfect.
Cool, thanks. Sorry.
Okay, yeah. So to begin with, let's start with some terms to help you understand what this research is about.
Sorry, let me just put the thing at the bottom as well, because you can't see the title of the slide. Is that better? Maybe if we put it on the side there. No.
No, just the
Okay.
bottom. Okay, so basically pharmacovigilance is a process around monitoring side effects of drugs after they are licensed for use and they are released to the market. And more or less, this process of pharmacovigilance includes the collection of data in what we call spontaneous reporting system databases. So basically, these are just databases curated mainly by the responsible health authorities for drug approval, such as the FDA in the US or the MHRA here in the UK. And these databases mainly consist of just experiences of patients, what we call individual case safety reports. And these reports are basically submitted by either physicians or pharmacists or the patients themselves. And they report just what they experienced after they took a drug. So adverse events that might be causally linked to a drug. And as we can see here, these databases, here we have the counts, the report counts from FAIRS, from the FDA spontaneous reporting system databases. And we can see that there is like a rapid increase, especially in the last 10 to 15 years. So we've got around roughly 2 million reports submitted, new reports submitted per year, only in like in the US. And yeah, we like this can be linked to various things, like more new drugs go to the market, or we have also more people getting older and then taking more drugs. So yeah, this rapid increase just makes things more complex to identify these novel associations we want to, and to curate, basically try and detect adverse drug reactions in these data. So what we aim to do with this data is to actually find novel signals, which are possible causal relationships between adverse events and drugs that have been used. And to do so, we need some algorithms, some methodologies that can separate the signals from the noise that exists in the data. And this is mainly done with what we call signal detection algorithms that try to identify if the observed and expected reporting rates of events for the different drugs are substantially different. So yeah, basically we look for patterns in data that suggest new safety information. So when we develop an algorithm, we need to be able to have an evaluation set and to do some performance evaluation. And in the case of pharmacovigilance and for signal detection algorithms, this is especially challenging in most cases because evidence is changing all the time. So it's really hard to establish positive and negative controls. So we need basically what the positive, we need to do two things, to find two things. The first one is the positive controls, which are validated positive associations between drugs and adverse events that can also be identified by clinicians in clinical practice so that we can make sure that they are contained in the data we have. And we also need, apart from positive controls and positive associations between drugs and adverse events, we also need negative controls, which are highly unlikely associations between drugs and adverse events. And things like associations, we have no evidence available about. So as my project was around drug-drug interactions and how we can improve the methodologies that are used for detecting those drug-drug interactions in these databases, we needed to come up with appropriate reference sets to evaluate the different methods, the existing ones and the novel ones. So more or less when I started my PhD, I did a search online, searched the literature, and I got a bit disappointed by what I found because the reference sets that were described were either not available, they were not open source, they were just described in papers, but I couldn't get my hand around those. They were in most cases manually generated and really limited in size, and also really limited in the number of drugs and adverse events that considered. So I decided that I need to come up with a reference standard myself and not use something that existed out there. And I went out and looked at different clinical resources for drug-drug interactions. These are basically websites where clinicians go and look for associations between drugs before they want to prescribe drugs to patients. And we can see that there is a wide range of these data sets. Most of them, unfortunately, they are not available as a database like SQL database or as a CSV file, but rather they are separate web pages where you type the drug you want to look at, and then you get like an HTML page that describes the whole interaction profile of this drug and like related information. This is an example from the British National Formulary, like a resource that is used here in the UK. And so I went on and said, okay, I will extract this data and I will establish my reference set myself. But then I said, okay, where do I start and how many data sets, how many websites I use? So I looked at one and then a second one and then a third one. And okay, I said, is there any overlap? I mean, which one I'm going to use? And I realized that like the overlap of these resources in terms of the information they included was really small. So I couldn't just rely on a single source to gather my evidence for the drug-drug interactions. So yeah, there was information consistency, and I needed to like basically set up a framework to get my reference standard and not by relying on multiple sources. And this resulted in the paper I described, I mentioned like in the very first slide. I'm not going to get into details on that framework, but basically the main steps was related to web scraping. So I extracted the data from separate websites from disparate sources. I then normalized the data. So the drugs that were mentioned and the adverse events that were mentioned in the different sources. I then found the intersection of these resources, and I also did PubMed search to ensure that I don't get any evidence for the negative associations I established. And I managed to come up with a reference standard that consists of about 10,000 positive controls and around 5,000 negative controls for DDIs, for drug-drug interactions, and also some associated information for the constituent drugs. And yeah, so like this work, which resulted in this data set called Crescendi, contributed in like a scalable, not only the data set itself, but also a scalable approach that can be used to renew and to update the reference set in the future using less manual effort, as the process is semi-automated, and also exploit the multiple DDI information sources that exist out there. And in the future, I would be very glad to see automated processes in a similar way in my field for retrieving the information, and also like to use standardized forms of evidence data so that we can facilitate the research in signal detection. And that was it from me. Thank you. Yeah, I would welcome any questions.
Yeah, so does anyone have any questions for either from the audience or from the chat online as well?
When you look at the sort of signal data, how much of it do you sort of go back and look, okay, so these two things, there is some knowledge of the biochemistry that would suggest that, yeah, that's, whilst quite perhaps rare, is we know that chemically that's possible compared to others that perhaps actually there's no way it could be fake. We've no idea. There's no sort of basis in chemistry as to why that would be the case.
Yeah, I mean, all these were mostly, I mean, there are a lot of such resources online. I'm not sure if you're talking about the resources or the very information that
Possibly both.
yeah. Yeah, because like I can say for the second part, like in terms of how much of the information is according to like biochemical, like is like evidence-based based on biochemical processes and like physiology. But I can say that these were more, I mean, the resources that I used were based on things that we can see in clinical practice. So they're not only potential, because like there is a potential for drugs to interact inside the body based on biology. Yeah, there are a lot of combinations that might look plausible, but they don't appear in clinical practice. So I'd rather, like, I only try to include clinically relevant things, so things that actually have a clinical manifestation.
One question, does that include exceptions such as a specific person reacting to a certain drug in a slightly different way to, let's say, the general population?
Yeah, I mean, this is mainly the case with side effects and drug-drug interactions. So you don't see everybody react in the same way when taking a specific drug. So yeah, this is like, it's an individual. I mean, there are information that exists inside those resources that mention that, okay, people who have a specific mutation might be more prone to having this side effect. So this type of information is there for evaluation for clinicians to aid prescribing and all these processes. But yeah, it's quite an individualized thing to say if the side effects are going to be manifest or not.
I also have a couple of questions from the online audience. So Simon says, might be worth commenting on the merit of automating the generation of the reference sets versus doing it by hand, as people have done previously.
Yes, yeah. So as I said, like the size of the reference set we managed to get by automating the process was like 15,000 controls. When we have reference sets by hand, as it has been done, is around like 1,000 or a couple of thousand, because yeah, it is based mainly on evaluating every single case. Like clinicians evaluate every single case, but if you try and automate the extraction of multiple clinical resources and then find their intersection, all of this in an automated way, you can be more, like it's a more reliable data set that you end up with without having clinicians like commanding and trying to evaluate every single case separately. So yeah, this is what this process, this automation enables.
And then Helen also has a question, if you'd like to unmute yourself.
Sure. Can you hear me? So you can hear me? Yeah. Good. Okay. So no, it was a comment, I think, really. It occurred to me when you showed your Venn diagram, so you've got different sources providing different information. There are some really nice techniques in field ecology where you can use methods from capture recapture to look at trying to estimate true underlying numbers and so on. It was really a comment. I wondered whether that would be a literature that it might be worth looking at when you've got that kind of disagreement between sources. We've applied it in the context of looking at disagreement between different organisations reporting outbreaks and so on. I mean, I'd be happy to chat about that as a point if you thought it would be interesting.
Okay, yeah, very interesting.
And then Simon's responded as well to your previous comment, saying if you do it by hand and make a mistake, it's a nightmare. If you automate it, you edit Python and press go again.
Yeah, that's true.
John, would you
I
like to ask a
only
question?
have a comment to make. It's not really a question, but that your project's quite different to what most of us have done. And it's a really, really lovely project and a massive contribution to the wider community. So it's really, really lovely to see.
Thank you. And yeah, thanks everyone for all the comments and like discussions we've had throughout the years. And yeah, due to pandemic, it was really limited for the last couple of years, but it's been a really nice environment to work with inside the Risk Institute. And yeah, it's really nice to have people from different disciplines talk about things and present things from different fields. This is very helpful.
Yeah, absolutely. Thank you so much, Isabel. It's clear you've done so much work and like pushed forward your PhD so much since we last saw you. So massive congratulations.
Thanks,
Thank you.
everyone.
Can we have Nicola up next, please?
This is a hard one to follow.
So.
But I'll try to at least be.
Let me just double check that they can see that. Okay, can everyone see that?
Differential impact of the COVID-19 pandemic on laboratory reporting.
Perfect. Perfect.
Yes, it's very long. I know. All right. Yes. So as Simon already read from the slide, so I will be talking about how the pandemic impacted norovirus and Campylobacter and how the impact was different. And so why norovirus and Campylobacter? So most of you don't know what this is about. So both of these are agents of infectious intestinal disease. So both of them can give you gastrointestinal symptoms, diarrhea, vomiting, and that's where the similarities end. So norovirus is a viral pathogen, and it's the most common viral pathogen, and Campylobacter is most common bacterial pathogen. But then they have many differences, and that's why they're interesting for this comparison of impact. So norovirus causes outbreaks in semi-enclosed settings. So this is the biggest issue for the public health with regards to norovirus. And it's mostly hospitals and care homes where you have people who are with weakened immune system. Then Campylobacter, on the other hand, is more sporadic cases. So less outbreaks and more just you eat something, so you get it. This brings us to the transmission. So Campylobacter is mostly transmitted through consumption of uncooked food or cross-contamination during food preparation. And then norovirus is more person-to-person transmission, although there is some foodborne. Foodborne means that you eat something and then you kind of have the symptoms. So with norovirus, there is mostly shellfish, but not much. It's mostly person-to-person. And then the last point of comparison is that the dependence on weather or the relationship with weather. So we know that norovirus, there is a direct relationship. So we know that we have the peak in winter, and when it's cold, the norovirus actually spreads more. But then with Campylobacter, this is more indirect relationship. So it's more through how people change and how they behave in different weather. So when it's summer, for example, so they can do more barbecues outside, and then they can undercook food, right? So how did we can compare the impact? So the dependent variables here were weekly counts of confirmed cases of norovirus and Campylobacter. The method that we used is sort of like generalized linear regression for sequential data. So like GLM plus ARIMA have children, so that's sort of this. We chose a negative binomial distribution due to overdispersion. So we chose negative binomial over Poisson because we just have a lot of variance there because of the seasonality and everything. So we have two approaches when we kind of compared, but I will probably skip the specific ones because then it will take me too long, but we can go back to it if you are interested. And we will focus more on the overall impact, which was the kind of the approach that we chose for understanding the type of impact the COVID had. So this is simplified equation of the model, standard time series things, and then we have explanatory variables. Here we used temperature, and that's why I mentioned the weather, because here temperature is it's sort of our baseline or covariate that was not impacted by the pandemic. So that's why it's important that we have this here. But also you need to keep in mind that for Campylobacter, this is slightly less relevant indicator. But then everything else changed, so it's kind of hard to find anything else. And then we have Easter and Christmas holidays, because in reporting, usually you have this dip around holidays. So it's sort of just what we know based on the past surveillance. And then we just add one more variable, which is just an indicator of when the pandemic started. So it's essentially just in time, which weeks where we say that it was the pandemic. So we tested also multiple starting days, but it was all around the first death in the UK, so that people may have started to react. And then I'm just going to skip this. So the overall impact. So the two types of impacts that we were testing for were constant impact. So that was just the line. So we would say that there was an impact at the beginning and then nothing really changed. It was constant. Then transient shift, which is exponential decay. So we have three types of how fast it was improving back, right? So here we would assume that there was dip at the beginning and then slowly it was improving. And we also did here the significance test. And essentially the question we were trying to answer was whether the model where we included this pandemic, so one of these sort of variables, so when this was included and then when it wasn't included, and then we would say that it was, if there was a significance, we would say that there was an impact. So here are the results for this bit. Norovirus works best with level shift, so there was constant impact, and we had significance level at 5%. And then Campylobacter showed best performance with transient shifts. So the impact of the pandemic has changed in time. Also, the significance was only significant at 10% level, so but you might see why when I show you the graphs. So you can see the purple line with the ribbon around it. So that's the uncertainty, and that's sort of the expectation what we had for the season. And the green line is what really happened. So clearly there was an impact, right? So it went down and it just stayed low and didn't really recover until like maybe this summer. So even though this is just until November, but just insider look, it was until summer. And Campylobacter, you can see that there was this huge dip at the beginning, but then slowly it sort of came back. So there was still some decrease, but not as much. So very different, visually, very different impacts. Okay, I'm gonna skip this one. And so the total estimate was so the true reduction was somewhere between 47 and 79%. So there you can see a lot of uncertainty around that. And then Campylobacter, what the result tells us is that it was different. So for example, in April, it was somewhere between 19 and 33%, and in August, 1 to 7%. So norovirus was impacted more negatively by the pandemic than Campylobacter. But why this didn't happen? So I had this comparison at the beginning, and when we kind of add in what we know about the new coronavirus, SARS-CoV-2, so we will have the commonality with norovirus that it causes outbreaks. That's why we have this pandemic, and then person-to-person transmission. So we could say that the new coronavirus is more similar to norovirus compared to Campylobacter, and so we can suggest that there was actually reduced transmission. So it's not only that there was lack of reporting, but this was probably where they are most different, norovirus and Campylobacter, that there was a reduction in through transmission. There are some other reasons as well. So for example, Campylobacter is notifiable disease. What this means that you need to report it, right? And also it could be kind of related to the perception of the healthcare staff that this is more important, right? So if you have a crisis, you will rather avoid testing for something that is voluntarily reported rather than something that you really have to report on. And then there is also potentially health-seeking behavior factor, like more severe symptoms. So in Campylobacter, there can be blood in the stool. So that could be perceived then as like, okay, I have one in the stall, so I should see a doctor. Whereas in norovirus, that could, feel more like, okay, I can probably manage this at home. And there are some other reasons as well. I skipped that bit, but the main limitation was that we only had the national estimate, but we know that with norovirus, there is difference across different regions. So some of them don't really report much, and then there are some that report very well. So there probably are regional differences. And this is just that the presentation is based on the previously published work. So this is something that we did with my supervisors and collaborators from Health Security Agency. And all of the funders, mine and supervisors, all the logos. And then that's it. Thank you.
Does anyone have any questions for Nicola? Alex, maybe you want to start off?
Yeah, just great presentation, by the way. Have you thought about looking at, I don't know, like changes in behavior due to the links between norovirus and coronavirus? Obviously, the change in activity of the population reduced the spread of norovirus as well.
Yes.
Now we've generally shifted to activity being more like what it was, but with a predominantly vaccinated population for COVID. Could it be interesting to look at if there is still kind of a transient shift that's more permanent for norovirus, even like we've gone back to mostly how we were, but things are not quite.
Yeah.
So using like the level of norovirus as like a proxy for how things are actually shifting back to how they were.
Yeah, that's actually, that's a good question. So actually what was happening this season, it was very interesting because people were, there were fears that this will be really bad season for norovirus because there was also a new strain coming up. And usually what happens is that when you have a new strain, so people don't have immunity, right? So there was the expectation that it might be extremely bad, but then it really seems like people are still careful because it really didn't happen. And even though there were, even from summer, we already saw there were outbreaks in nurseries and then schools, and it usually sort of travels nurseries, schools, and then care homes. And so it is very interesting that it's still not entirely where it should be, but there are also, it's just so complicated to even analyze the data because, for example, what we found was that even some of the methods when it changes, so one lab suddenly changes something and they suddenly report much higher numbers than they ever did. So then it just sort of ruins all of the signals. So it's just so hard to kind of unpack what is happening there because it just really, I think this was sort of nice that we found that actually when you just have this 0-1 kind of indicator, so it improved even the predictive performance much a lot with just that simple use case. So I think yeah, like it's very complicated. Yeah, so it's really hard to kind of unpack. But yeah, thank you for your question.
I think Simon has a question on the call. If you'd like to unmute yourself, Simon.
Yeah. So it's kind of related. So I think he used TS. I can't remember what the package is called. TS something as the tool that did the actual TS count. Was it? Is that right? So was there a particular reason for using that, or was it just a convenience? It's a leading question, so I'll tell you why it's a leading question before you answer it. So I think if you were to use something based on STAN, there are various GLMM, I think is one that you could have used instead. I think you could answer the previous question by doing a kind of like a meta-analysis, so you understand the impact of an intervention on the transmission between individuals, and you'd be able to decouple the parameters of the population from the parameters of the virus, which currently is an absolute nightmare for COVID if you treat it as a single disease. So the leading question is, why did you use the particular package? But the motivation is that we did something more interesting.
Yeah, definitely there was factor of convenience, but also because this method was specifically built up for estimating impact for count data that are coming from these surveillance systems. So so it was very kind of I don't want to say bespoke because obviously it's generalizable, but yeah, it was very specific for this use case. So yeah, it fit well. But I was looking Bayesian methods as well, but
no, that's fine. Yeah, thank you. So I suppose the thing I was trying to make sure is that there wasn't a strong motivation for using the package that would prohibit using a Bayesian approach downstream.
No.
No, in which case, good. And thank you. Nice talk. Cheers.
Do you have any more questions from the audience? Either?
Yeah, I want to ask regarding reporting rates and how they changed. I mean, how the number of tests changed over the pandemic. Because with counts you get the positive, but you don't know how many negative tests you come up with.
Yeah, this is a very good question. So the bit that I wasn't talking about, so I also try to look into the impact thanks to the data we have on COVID. So I also considered the conducted tests on the total number of conducted tests for COVID to kind of gauge like what was probably happening with the testing, and we saw that there was slightly higher importance in norovirus than Campylobacter. But this is so difficult to say because also this is my one of the main recommendations that I will probably make in my thesis is that for norovirus and for many gastrointestinal infections, you don't really know what is the number of tests. Like you just have no kind of idea of what is actually the positivity rate or something like that. And so yeah, so this is like a huge issue that it's not even, the data is not even collected, that we did this test and it could have failed, right? Like how many wrong tests, maybe we ran out of the samples, like there is just so many things that could have happened and it's just not even being captured. So
I hope that because like over the pandemic and with COVID, a lot of systems and such like infrastructure we're creating, so probably we can make use of them in the future to be able to get like better data on other diseases as well.
Yeah, I hope so too, because I think it really showed people how important it is to really focus on the epidemiology and infectious diseases in general, because people just thought like, oh, infectious diseases, we have vaccines, like we are over this. But really, it showed us that not really so.
Yeah. Alex, last question.
Yeah, just one more, sorry, no one else has gotten to that. Do you know the characteristics of the diagnostic tests for norovirus? There might be like, there's a couple of different ones, but if you have those characteristics, could you kind of infer back from that what the kind of plausible combinations of like prevalence in the population and reporting rate would be, given that you've had like 100 reports in 1 week? If you know the characteristics of that test in terms of the sensitivity and specificity, could you kind of infer how the prevalence might be shifting from that?
Well, it's kind of complicated. So because usually it's tested with so multiple, you would test multiple gastrointestinal pathogens at once, because you can also have co-infections and things. So and also it depends on what your sample is. So sometimes, there's some you can even have in vomiting, you can have vomiting sample. It doesn't need to be stool all the time. So, and the laboratories kind of can change the standard a little bit. So, and also kind of not everyone does it the same. So that's probably the biggest issue, that every region can slightly, change the approach, or it takes them longer to onboard on what is recommended by the national teams or whatever. So there is a lot of kind of little things which is really hard to kind of account for them. But what we did with the previous work, as suggested by Helen, my supervisor, so there is use of random effects. So what you can do is that to actually there are some regions where we know that the reporting is quite all right. So we can at least pick up seasonality and things like that. So we know that the data is quite okay. So then you can use random effects to just get the idea of what are the differences compared to other regions, and then you can kind of borrow this one strong region, and then that will inform the other regions that have weaker data.
Okay.
So that's one of the solutions.
Okay, thank you very much, Nicola. Wonderful talk, and congratulations on your publication. Thank you. Next, we have Nick Gray talking to us about interval uncertainty. Yeah, a second. Interval uncertainty and logistic regression.
I'm going to share from here because my slides are a mess.
Okay.
So it's probably the safer bet. You'll see why.
How would you?
I'll just share from there.
Okay. Okay, sure. Yeah, no problem. Let me just give you the sharing privileges. So if I stop sharing, and then do you want to try sharing now?
Yeah.
Okay. Right. Can everyone see that? Okay.
Yeah, it's fine.
Okay. Perfect.
Yeah, these slides are a mess because when I made them, I had loads of free time, and I didn't have loads of free time. So let's go. So for those that don't know, logistic regression, what you're doing is you have a sort of a binary label, sort of true, false, sick, well, or 0, 1, which is sort of the simplest case. And what you're doing is you've got some features and you're using it to make a prediction based on the probability, which for some reason is pi, of it having that sort of binary label. So there's many applications across all sorts of different things to pick some ones that, well, came from Alex, essentially. Probability of a patient surviving general anesthetic. There's these people that came up with this test that's called POSSUM. And essentially they talk bells and whistles about it, but it's a logistic regression. It's also been used, sort of the probability of a sports team winning a match. You can use logistic regression. The risk of lightning strikes, logistic regression. There's lots and lots of different applications. And you could consider it as sort of a key machine learning algorithm. People that do machine learning perhaps don't necessarily, but it's sort of really right up there. It's sort of one of the simplest tools you've got. And so to draw examples, you've got these data points, and then what we're doing is sort of fitting this equation, sort of finding the beta values that sort of best fit the data points. And then what we can do is take a sort of a cut and say, okay, so we have a new variable that's sort of 6.5. What's the probability that is a 1? And we get that probability of sort of 0.69. If you couldn't tell, I had loads of time when making this, and it's way over animated. And so that's what we have. And then we can use that in order to make a prediction. If you're sort of a true statistics believer, you might disagree with this, but this is how it's used in general. So what you can do is you can compare that probability against some threshold value. And you say, well, okay, so we'll say it's true if it's greater or equal to the threshold and 0 otherwise. And obviously the simplest example is if you say, well, if C is 0.5, then what we're saying is it's more probable to be true than false. So therefore we'll just define it as true. However, other values you might select depending on the risk appetite. So going back, the sort of POSSUM algorithm that does logistic regression for the chance of surviving a general anesthetic, they set this value to be sort of 0.05. So if it's above 0.05, then you consider it as actually this is high risk. We can't just define it as safe. There is some chance that they deem as unacceptably high. And then once we've done this, we can sort of generate a confusion matrix and sort of take out what the sort of number of sort of true positives and false positives, etc. are. And then from this, you can calculate some statistics and sort of classically the sensitivity and specificity. You can do, if you are in machine learning, you call sensitivity precision, and you'd also have recall as well. And there's all sorts of different statistics that you can pluck out the confusion matrix. Sort of the false positive rate is another one that's sort of often quoted, which is in effect 1 minus the specificity. And then there's sort of other things you can do if you want to know, well, actually, how good is the logistic regression model at sort of fitting to the data? There's several ways. The one that I use in the sort of paper version of this presentation is the Hosmer-Lemeshow statistic. So what you do there is you look at the sort of observed number of cases minus the expected number from the logistic regression model and the observed number of not cases, which is the O0 compared to the expected number. And then you sort of group them all together, and then you work out what the sum of this is for all the groups. And then if you compare this to a chi-squared distribution with G minus 2 degrees of freedom, where G is the number of groups that you collected everything into, then you can sort of do a sort of a hypothesis test. And so for the example on the sort of previous slide, this is what you get. And obviously it's sort of a high p-value, so you sort of reject the null hypothesis, conclude, yeah, it does fit the data. Another way of doing it is sort of through what are receiver operating characteristic curves. And from here, what you do is you take the curve and you put the sensitivity against the false positive rate, and then you get this curve, and the sort of more up left this curve is, the better it is. The worst possible curve would be the dotted line, which would represent a random classifier, where essentially what you're saying is that it's just picking it out. If it was anywhere sort of bottom right of that blue line, you can sort of say, okay, well, you would have been better off just sort of flipping the classification round. You can calculate the area under these curves in order to compare the two together. And so for this example, the area under the curve is 0.923, and obviously in a perfect case it's 1, and the worst possible case it's 0.5. So imprecise data, this is probably obvious to everybody in here, but anyway, there's sort of two ways you can have it. You can have the sort of epistemic uncertainty, so the sort of lack of knowledge of what the values in the variable are, and the sort of the allium which is sort of covered. And the sort of standard logistic regression covers that uncertainty though, because otherwise, if it wasn't there, then it'd be sort of a really easy example to get, okay, everything greater than point whatever is, yeah, that's all true and that's all false. It'd be a really easy example. However, that's not the case. It's sort of standard logistic regression covers that uncertainty by giving a probability. Don't know what that means. However, epistemic uncertainty you sort of characterize using intervals, which is sort of what I've done here. And it's sort of in logistic regression, you can have these intervals in both sort of the features of the model and the labels. So within the features, you could say, actually, we're going to predict something based off how old something is, but there may be uncertainty about that. Or you may simply not know what the final outcome status was because people have dropped out of trials or it's uncertain in some other way. So you have interval features. So this morning's bad bit of PowerPointing, but essentially what we can do is consider the sort of set of models that are possible based on the intervals within the data. And this can be estimated, and I'm sort of stressing estimated because whilst my numerical examples have found that this is the case, I'm not convinced it would be the case in general, especially once you move to more complicated models. You essentially have to find the sort of minimum and maximum values and the variance of the intervals, and then use those points to construct the logistic regression, which can be quite extensive. So to give an example, if we have this model and these sort of interval data points, what we can do is set a value for all these data points and then draw a logistic regression. And then we can move these data points around. And as you can see, you sort of get some quite different values. And then once we've found the sort of minimum and maximum values, then we can put a bound on it and sort of get this sort of imprecise logistic regression model that we can use to make a sort of an imprecise prediction where we have an interval probability. And this is what we do. And you can, what comes next? Why is this not stopped working? Well, so for the other way around, if you have, it should be interval labeled, but anyway, then essentially you could have somewhere we don't know what the label is. We don't know whether it should be 0 or 1. And what we can do is sort of take the data set and go, okay, so what if they're all 0? What if they're all 1, or some combination in between? This is some sort of quite high computational complexity, and the sort of next steps to this are to try and bring that down and to work out which are the values that we actually should look at, because they're the likely to be the extreme ones. And so as in a simple case, we have one point where we don't know the value. You've obviously got, well, we'll call it 0 and we get this, or we call it 1 and we get this, and that's fine. However, in reality, if we say have 5 points, then all of a sudden there are a lot more examples. And if you sort of can shuffle through, you can see that actually some of them are quite different to each other. And actually with just sort of 5 points, which I think in this case there's sort of 5 out of 50, and actually there's sort of a fair amount of uncertainty that's present just from those uncertain data points. And then if we have this sort of imprecise model, we sort of get imprecise predictions. And there's sort of 2 ways of doing that. So for ones that sort of straddle that decision threshold, we can't say whether it should be sort of predicted positive or not. And so what we have is you could say, okay, all those de nos, we'll sort of tabulate them directly in the confusion matrix. And then we get these interval values. It should be noted that there is dependence between these intervals. And so subsequent calculations have to be aware of that. And so you get sort of an interval sensitivity and specificity, which need to be calculated, being aware of the fact that the total number of positives in the example hasn't changed. So it's sort of a slightly different way of calculating it. The other way that we could predict these is sort of take the ones that we're not able to make a prediction because of the uncertainty, and tabulate them separately. And so a sort of a no prediction row of the confusion matrix. And in this case, it sort of makes sense to consider what the sort of predictive sensitivity and specificity are. So of those that had a prediction, how many of those predictions were right, and can calculate that. The other thing that we can calculate from this, and this is what I've sort of defined as uncertitude, which is how many sort of positive examples there was no prediction for, and similarly for negative. And you can we can plot them to work out. So in this case, about 10% of the positive examples and sort of slightly more of the negative examples we weren't able to make a prediction for. And sort of using those statistics, we can do a sort of an imprecise ROC curve. So again, sort of plotting the sensitivity and the false positive rate, we get that, but we can then sort of swing this round into a 3D plot and see actually how the uncertitude affects. So you see as the false positive rate gets high, the uncertitude, negative uncertitude gets high, and you sort of see the same pattern on the other axis. So as the sensitivity gets lower, the uncertitude gets greater, although it's a little less clear on that side. And so then this is all well and good just on some randomly generated data. So we sort of looked at a real world example, and in which case there is this imprecision in both of the variables, independent and dependent variables. And these can be included by considering a combination of both the methods, which obviously then increases the computational complexity even further. And there's sort of many possible models that sort of really would like to reduce. And sort of the sort of next steps are to come up with the better algorithm. But to come up with an example, these people used logistic regression to model the risk of death after a burn injury. So the idea is sort of base it on sort of their models based on 40,000 samples, and there was sort of missing data within all of them. However, they use these things, and the idea being that if a patient presents to an emergency department, then you can use this information in order to predict the risk, and therefore make an assessment about whether or not they need further care or what level of care they need. However, I don't know why it did that. From this, you can see that the uncertainty is ignored. So there's missing values, and they just throw those missing values away. And but there's other ways that they did it. So their data set was sort of 0 to 80. If you're in that age group, you had a sort of precise, you are 26 or you are 63. However, if you're over 80, you were just 80 plus. And so they sort of characterize that by giving you a random age between 80 and 90, as opposed to anything smarter. Obviously, this gender in these race ones, sort of gender is male and female, and race is sort of white and not white, which is really sort of a blunt tool in order to make a prediction about somebody's health. And so, yeah, you're not white, so therefore it doesn't seem particularly fair, especially because there can be uncertainty there, and it's not a good characteristic. The total burn surface area is always a precise value, despite the fact you could have some uncertainty about how good it is, especially when it is a nurse that is estimating the value. They're sort of forced to make a precise judgment. And obviously, if somebody presents to an emergency department, they might not be able to tell you whether or not there was a flame involved in the injury, because they might be unconscious or whatever. So the final bit of certainty is the outcome status could be uncertain. So in the data set they use, there were some examples where the outcome wasn't known, and for whatever reason that information was lost. However, we can compute with these uncertainty using the methods that I've presented. We don't need to throw it away or make some statistical judgments in the way that they've done. And so from this, we can get the sort of following sort of imprecise confusion matrix. For comparison, this is what you get if you use their methodology for dealing with the uncertainty. And so as we can see, it's sort of similar enough, which is what you'd expect, but there's obviously some uncertainty around the sensitivity and specificity. However, in this case, with this uncertainty, we sort of look at that and go, okay, so could we make a better decision with the patients that we don't actually know the information for? So for example, we might want to reduce the number of false negatives, because we might want to say that actually the people that we don't think are going to die, we're quite happy to leave them on one ward, but for the people that are high risk, we want to put them in intensive care. And then there are these people that we just sort of don't know what to do with, and it seems a sensible thing to sort of go, okay, we'll put them in intensive care, because therefore if they do turn out to be sort of, they should have been high risk, then they're cared for. And in this case, we get this, whereas actually what we've done is sort of pushed all those uncertain people into the high risk category. And as you can see, the specificity, which is the one that we're trying to maximize, has gone up. The sensitivity is slightly lower, but we're sort of happy to make that judgment of actually it's we're happy with that. And we could also edit that again by sort of choosing a different decision threshold. To conclude, we can include this interval data sort of directly within the logistic regression model. We're doing this by considering the sort of set of possible models in a sort of imprecise case. However, it can be computationally expensive if there is a large amount of imprecision in the data set. Sort of the next steps are to try and deal with that and take that and use it and sort of make it optimized. And think quite soon you can still use the sort of standard sort of logistic regression models for goodness of fit and the predictions. You just have to be careful about dealing with the intervals and dealing with dependence between the intervals and making sure wherever possible that you sort of reduce things down to sort of using the interval once. And so thanks for watching. The paper version of this talk is on archive. If any of you wanted to scan the QR code, you can read it. There's also a GitHub that's linked from the paper. Yeah, so if you've got any questions, then feel free.
Yeah, thank you, Nick, for your wonderful presentation. It's amazing what you've been able to achieve over the past few years. So does anyone have any questions from the audience? And actually, I would like to say those animations that you made for the imprecise probabilities were amazing. I might have to ask you how you did that.
Don't ask, don't start. It was a bad idea to start.
Yeah, they were very impressive. So I think actually we've got Helen is keen to ask a question. So if you'd like to start, Helen.
Sure. So it's interesting, fascinating actually, really interesting food for thought. I suppose I have some experience of trying to communicate the results of logistic regressions, and I was just interested in how the outputs of this are received sort of by people who are the clinical decision makers, because you've got that extra level of complexity in there in terms of having to communicate that. So I'm just interested in that really.
I suppose the short answer is we haven't tried. This is as such, the code is there, but we haven't done anything practical with it. So it would, but it would sort of fall into sort of general conversations that we've had in the Risk Institute about how you should communicate uncertain risk anyway.
It's a massive challenge. I agree. Yeah, no, it's really interesting thoughts. Yeah.
So in a slightly different project, but quite close to this, we have had some clinicians say they actually like getting the interval of probabilities about when we're trying to give a probability that a patient has a disease. They actually like seeing that uncertainty in some situations, in some scenarios, and some clinicians. So diagnosticians typically seem to be able to handle uncertainty in a more subtle way than perhaps your general clinician does. And they really do seem to be. I mean, they don't trust a single probability for a patient. So that interval of probability or some more expression of uncertainty, some like, but I wouldn't say that's all of them.
The other thing that it does that's sort of come up on a sort of different project that I've worked on for a bit is it sort of gives an avenue for which ones are the most uncertain. So if you have to make a prediction about a person and actually you see that interval is really wide, then you go, okay, so actually this one, if we could find out a little bit more information about, then if we can reduce that uncertainty, we see that actually which ones are high risk with high uncertainty sort of enables you to make a little bit of a better judgment call, perhaps.
Yeah, I think there's some really interesting work, just as a comment generally. So one of my hats is I'm the career development lead for the HPRU in gastrointestinal infections, and a big component of what we do in there is about knowledge mobilization. I think there'd be a really nice piece of knowledge mobilization work to do on the back of what you've already done here. So I mean, again, happy to chat at some point if you think that would be interesting.
Yeah.
Peter, would you like to ask your question?
Yes, sure. Hi, everybody. Thank you, Nick, for the presentation. I have one question, but possibly two, maybe. You had emphasized the word estimate in one of the slides. So how have you done the computation? Has this been done via interval arithmetic? If not, why not? And maybe a follow-up, because I don't want to interrupt anymore, is do you see this generalized to other regression, other classification models, more complex ones as well?
So to answer the first question, so I say estimate because essentially the way that I try to work out whether or not it works is sort of take that sort of generate a data set and then sort of fit and then select the points from within the intervals that sort of correspond to sort of the most left, the most right, and then the sort of steepest and shallowest curves that you can fit. And then essentially what I did is ask it, okay, so they're the sort of bounds that I have, and then fit a load more models by just taking random values. And then what I saw was that actually it always seems to be the case that they did fall in within the bounds. However, that is sort of an extremely computationally expensive simulation to do. And that was only on a one-dimensional data set. So if you had an n-dimensional data set, I'm not sure. I would be happy to say, yeah, that these are probably good estimates for what they are, but I'm not sure you would perhaps cover every single possible edge case that was there. So that's the first part. On the second part is, so you could sort of use this idea for other sort of models, because you could apply a similar idea to regression. However, I know that Marco and Krasimir have thought about that. You could apply it to other machine learning techniques. So a neural net is probably quite a complicated one to do it on, but sort of a support vector machine, you could perhaps come up with a set of possible answers based on the classification and the uncertainty. You could probably do that with. I just have.
So just to help me understand, then you haven't that sigmoid we also is not the logistic function, or is it?
It is, yeah. Right.
So my question was, have you tried applying interval arithmetic to that logistic function? Instead of selecting, upper bound, lower bound, trying different combinations, just pass the full intervals through the logistic function and see what comes out. Or you think that's not an option?
Well, you can do that, but you have to be extremely careful about that. That function doesn't play particularly nicely with intervals.
Right.
Is the first thing I found. And the other thing is you then need to do a interval maximum likelihood or an interval gradient descent approach in order to fit it directly. I guess, well, if you know how to answer them, then let me know.
Thank you. Thanks.
Do we have any questions from the general audience, Benji?
Yeah, no, that's it, that Nick. But so I guess if you've got like complete data set, a sort of similar thing to do would be bootstrapping data. And so I just wonder, have you thought about like comparing the performance of the two in terms of like, can you fit less models with your method to get the same results?
You can do bootstrap, and I did try it. And I'm not, I think it just gives you that sort of single precise value, I think. I did try and I can't quite remember the answer off the top of my head.
And Simon, did you have a question?
Yeah. So this will be unsurprising for those of you that know me. So given the task of trying to output this kind of sensitivity, I think you're getting hamstrung by considering intervals. So I would put a hyperprior on the model and consider it in a Bayesian way that will give you the same family of outputs, and that's what people are doing with neural networks at the moment. So they are trying to do what would be equivalent to putting intervals on the data, but they're thinking of it from a Bayesian perspective. So I'm not disagreeing with the idea of having some notion of uncertainty. I struggle to see why the interval arithmetic or thinking of it in terms of an interval problem helps. So think about that for a second, and then to respond to what I suspect was Dominic's question, I can't quite see because you don't occupy many pixels each. The experience I have of conveying those kind of sensitivity outputs is that it's the people who understand regret that most like to see uncertainties on probabilities. So I suspect the reason that the diagnostic people are keen on it is because they see what happens later. Whereas if the universe kind of ends after the probability is declared, nobody seems to give a monkeys about how certain you were about its value. So that's my guess anyway. Yeah, Nick, any thoughts?
To the first question, I'm not sure there is a short, succinct answer that I could give you that would convince you, perhaps.
That's fine. Good answer.
If you don't like the idea of intervals, then this is
no, I don't. It's not that I don't like intervals. I just think that constraining yourself to think in terms of intervals is, as you highlight, computationally nightmarish, and there are other ways conveying the same information that would seem to be computationally advantageous. So then it becomes a question as to, do you really want intervals if you can get an estimate of the interval out the other end via a different route? How precious are you about the methodology, I suppose, is what it boils down to. But that's a philosophical question. So there you go.
Okay, thank you very much. Let's give it a round of applause. Ian, if you'd like to come up next. I think the computer's just here. It's being inside there. Houston.
Yeah.
Oh, the mouse is laggy or something. This one.
Risk, yeah.
The mouse is glitching. Apologies. Okay. Fantastic. Okay. So Sebastian will be talking to us about coupling tools with advanced multi-scale core simulations.
Hey, so yeah, as some of you may know, my name is Sebastian Davis, and I did a bachelor's in fundamental physics at the University Complutense of Madrid, and then a master's in physics and technology nuclear reactors at the University of Birmingham, and I'm currently doing a PhD project in the coupling of subchannel analysis tools with advanced multi-scale core simulations here at the University of Liverpool. So to start with, nuclear power can allow to answer the energy demands in the UK, as it does not depend on weather conditions, which is of vital importance for the UK due to its unstable weather conditions, as opposed to green energies. And it does not produce CO2 emissions as opposed to fossil fuel energies, which adheres to the zero CO2 emissions policy of the UK. Since the main type of nuclear reactor being treated in this project are pressurized water reactors, the main elements are described, consisting of the reactor vessel, which is formed by fuel assemblies, each of which is conformed by fuel rods as well as control rods, all of which are submerged into the coolant moderator. Each fuel rod is conformed by the fuel, which is composed by uranium-235, but it has to be a fissile. The clad used to contain the fuel, which has to be good at heat exchanging. And then the control rods, which are used to control the fission chain reaction, which have to be good for neutron absorption. So boron carbide is used. Then there's the pressurizer, which is used to keep the reactor at the right pressure, the steam generator, which is used to exchange heat between the primary and the secondary coolant circuits, the turbine and the generator used to convert mechanical and thermal energy into electricity, and the condenser, which is used to cool down the coolant from the secondary coolant circuit, which is then pumped back into the system. So reactor physics depends on the interaction between power production, which is studied through the subject of neutronics, where the Boltzmann equation is solved using either simplified neutron diffusion or full neutron transport, and then heat and mass transfer, which is studied through the subject of thermohydraulics, where the Navier-Stokes equations are solved using either simplified fluid dynamics or full mixing fluid dynamics. Nuclear simulation software allows detailed calculations of the neutronics and thermohydraulics of nuclear reactors, which allows in turn to improve their economics and safety. With nuclear simulation software dates back to the 1980s, consisting of NOLO codes, neutron transport codes, lattice codes, and fluid dynamics codes. None of these codes provide full coupled reactor physics at the fuel pin level, and hence full neutron transport and full mixing fluid dynamics at the fuel pin level. So modern computers could allow full coupled reactor physics at the fuel pin level, and hence, in exchange, remove extra safety margins that were introduced by the nuclear regulator due to formerly encaptured physical effects. So it is of great interest to use state-of-the-art nuclear simulation software, as it achieves a good balance between the demands of the nuclear regulator, the industry, and academia. Some examples for LWRs include NeuroSim and CASTLE. NeuraSim is based on coupling different existing codes to provide either simplified coupled reactor physics at the fuel assembly level or improved coupled reactor physics at the fuel pin level. In this case, neutron diffusion plus full mixing fluid dynamics would conform improved, while simplified is just neutron diffusion with simplified fluid dynamics. Then there's Castle Advanced, which is based on coupling new high fidelity codes to provide full coupled reactor physics at the fuel pin level, and hence full neutron transport and full fluid dynamics at the fuel pin level. However, NeuraSim is not adequate for the UK, as it does not provide full neutronics at the fuel pin level, with lattice codes only being used to provide fuel assembly homogenization used in nodal codes. While Castle Advanced is not affordable by the UK due to the extension of the full coupled reactor physics at the fuel pin level to all of the reactor core. So, and hence an intermediate multi-scale multi-physics software development is proposed, which aims to answer the demands by overcoming conservative designs to improve the economics and safety of nuclear reactors, by developing a coupling software environment to improve data transfer between the codes, with coupling extending to the fuel pin level, as it is quite useful in certain areas of interest, and integrating the codes into a user-friendly software framework. It aims to operate under reasonable computational power by restricting the either full or improved coupled reactor physics at the fuel pin level only to the areas of interest, while still providing simplified coupled reactor physics at the fuel assembly level in all the reactor core in general. Well, here we can actually see a whole reactor core being treated at the fuel assembly level, where a certain fuel assembly here is being treated at the fuel pin level. So simulation codes that will be integrated into this multi-scale and multi-physics software development include nodal codes such as DIN3D to provide both simplified coupled reactor physics at the fuel assembly level and at the fuel pin level. Also, neutron transport codes to provide full neutronics, full neutron transport at the fuel pin level. Then subchannel codes such as CTF to provide full mixing fluid dynamics at the fuel pin level, and fuel performance codes such as Enigma to provide material sciences at the fuel pin level. So moving into my PhD project, several aims within this multi-scale and multi-physics software development include the coupling of DIN3D and CTF to provide improved coupled reactor physics at the fuel pin level, and hence simplify neutron diffusion plus full mixing fluid dynamics, as well as coupling Lotus and CTF to provide full coupled reactor physics at the fuel pin level, and hence full neutron transport plus full mixing fluid dynamics. All the objectives within the aim of coupling DIN3D and CTF have been covered in the form of open access journal articles. First of these objectives, the CTF and Flocal thermohydraulics validations and verifications within the multi-scale and multi-physics software development have been performed to evaluate the accuracy and methodology available to provide thermohydraulics at the fuel pin level. The CTF accuracy validation and verification has been performed through the PSVT benchmark, which is an experimentally validated and computationally verified benchmark for LWR thermohydraulics, which includes a series of tests such as multiple 5x5 bundle tests. Then the CTF and Flocal, by the way, Flocal is the thermohydraulic solver included by default in the nodal code DIN3D. Yeah, so we are deactivating it in the coupling, and adding CTF later to it. Anyway, so the CTF and Flocal methodology verification has been performed through the Flocal developer benchmark, which is just a proposed benchmark for LWR thermohydraulics, which includes tests for 2x1 bundle. So moving into some of these results, regarding the CTF accuracy validation and verification, the void fraction mean error is presented for several system, subchannel, and CFD codes at different heights, where CTF, which is the black bar, is in particular observed to be very accurate compared to the other codes. Then regarding the CTF and the Flocal methodology verification, the void fraction distribution is presented both for Flocal and CTF where CTF is observed to provide a wider range of cross-flow and mixing methods compared to Flocal, including the Rogers and Rosehart heterogeneous automatized mixing method, as opposed to Flocal, where only the no cross-flow method is available to the public. Since these other methods were just tested during the developing stages of the code. So moving into the second objective, the DIN3D and CTF coupling within the multiscale multiphysics software development part 1 has been performed to evaluate all inner iterations within an outer iteration to partially provide improved couple reactor physics at the fuel pin level. This inner iterations coupling verification has been performed through the KITES benchmark, which is a benchmark for LWR neutronics and thermohydraulics without tabulated results, which include tests for multiple 17x17 fuel assemblies. The partial coupling between DIN3D and CTF involves several steps. First, the simulations in DIN3D, then the transfer via external coupling scripts of the power distributions from DIN3D to CTF, then the simulations in CTF, and then the transfer of the feedback distributions via external coupling scripts from CTF to DIN3D until a convergence criterion is met. Although in this occasion, only one outer iteration was carried out. So regarding the inner coupling iterations verification through the thermohydraulics, the average fluid temperature, the average transversal fluid temperature for the fuel assembly is presented for DIN3D, both DIN3D and DIN3D plus CTF, where DIN3D and CTF is observed to provide more homogeneous values, although the average fluid temperature remains within similar values for both couplings. Okay, so moving into the last objective within the aim of coupling DIN3D and CTF, the DIN3D and CTF coupling within the multiscale multiphysics software development part 2 has been performed to evaluate all outer iterations within the convergence criteria to fully provide improved couple reactor physics at the fuel pin level. But this one has just been drafted. It's not published yet. This outer iterations coupling verification has been performed through a modified version of the KITES benchmark, which as mentioned is a benchmark for LWR neutronics and thermohydraulics, which includes, as mentioned, the multiple 17x17 test, but also a mini core has been created. The full coupling between DIN3D and CTF involves several steps. First, the simulations in a personally modified version of DIN3D, which allows the input of the feedback distributions from any external code rather than its own internal thermohydraulic solver flow code. Yeah. Then the transfer of the power distributions via internal libraries within the coupling software environment from DIN3D to CTF, as opposed to as it was in the one-way coupling. Then the simulations in CTF, and then the transfer of feedback distributions via internal libraries within the coupling software environment from CTF to DIN3D until a convergence criteria is met, which generally consists on both the neutronics and the thermohydraulics distributions reaching the steady state, so not changing anymore. So moving into some of the results, regarding the outer coupling iterations verification through the neutronics, the power distributions, the transversal average fission power distributions, both DIN3D and DIN3D and CTF are presented, where in particular DIN3D and CTF is observed to provide very close distribution as a DIN3D. However, the effective multiplication factor, or the famous criticality constant, is observed to be less conservative in the DIN3D and CTF coupling as opposed to in DIN3D. It must also be taken into account that factors that influence the differences, because this case is obviously a very close case, but obviously the hotter the conditions are in the system, the higher the albedo, so that means the reflection of neutrons inside the system, as well as the crossflow and turbulent mixing. Those three factors combined yield to higher differences between both codes.
while the more standard the conditions are, the closer the codes agree with each other. So in this case, a more matching case was selected than in the previous paper. That's what I'm trying to say. So yeah, so the objectives within the aim of coupling DIN3D and CTF have been fulfilled by validating and verifying the accuracy and methodology to provide thermohydraulics at the fuel pin level, by verifying the inner coupling iterations within an outer iteration to partially provide improved couple reactor physics and the fuel pin level, and finally verifying the outer coupling iterations within the convergence criteria to fully provide couple reactor physics at improved couple reactor physics at the fuel pin level. Then moving into future work, the sole objective within the aim of coupling Lotus and CTF is still pending by verifying the inner and outer iterations, in this case combined, through the convergence criteria to, in this case, fully provide full couple reactor physics at the fuel pin level. And hence, I must stress, this is neutron transport plus full mix in fluid dynamics. This is neutron diffusion plus full mix in fluid dynamics. So I would like to thank Dr. Bruno Merck and Dr. Andrew Levis for being my thesis supervisors, Paul Bryce for being my industrial supervisor, Dr. Dennis Liskovich for his expert support, the RISC CDT for being my associated PhD program, the University of Liverpool for being my associated university and funders, Électricité de France, EDF, for being my industrial funders, the National Nuclear Laboratory for being my industrial funders, and the Engineering and Physical Sciences Research Council, EPSRC, again, for being my associated funders. Thank you very much. Any question? Yes. Yes.
Thanks for the talk. Usually, multi-scale model really challenging, and just a few practical questions. Can you say how many scales do you have in your simulations?
So, scales, you mean? So we're doing calculations at the fuel pin level. That's what's not currently available. Fuel assembly level is available by default in DIN3D. So what you usually do is that you first carry out full core simulation at fuel assembly level, then you get the peak power factors for every assembly, and you simulate the particular assembly by multiplying the standard power that you would associate to all the assemblies by that factor, and then you get the power for that particular assembly, which you would then simulate at the fuel pin level, and then after obtaining all of your results at the fuel pin level through the convergence, you feed it back to the fuel assembly calculations for an improvement.
And do you use something similar like HMM, or
I use
equation HMM standard?
How do I code?
Heterogeneous
Python.
No, I mean there is a general technique for multi-scale modeling called HMM, which stands for heterogeneous multi-scale modeling. So basically, it's model developed for multi-scale modeling generally, or is this something like equation-free approach?
Well, it's basically
just to clarify myself, HMM, it means like when you have macro solar, micro solar, and they're connected through the
coupling software environment. Yeah. So that's right. So DIN3D does the nodal code, the assembly calculations. When you go to the fuel pin level, the calculations are performed by Lotus, which is a code. I mean, it wasn't developed at the University of Liverpool, but it has been brought to the University of Liverpool by his developer. Yeah. While CTF is a fluid dynamics code. So both give you the fuel pin level calculations. DIN3D can also give you fuel pin level calculations, but they are just very simplistic because they do not include crossflow. What does crossflow mean? Well, basically, you've got all of the channels where you don't have crossflow, none of them speak to each other. When you have cross, in terms of thermohydraulics, in terms of neutronics, they do talk to each other. Otherwise, you wouldn't get a distribution. But the thermohydraulics, when there is no crossflow, they do not speak with each other. When you add up the mixing and the crossflow and turbulent mixing in CTF, all the channels, there is lateral flow that homogenizes.
So you're also assuming that when you do fine scale simulations, you assume that your macro scales freeze, right?
Well, not exactly freeze, but I mean, what do we mean by areas of interest? Areas of interest really means hot areas in the reactor core, and that's why sometimes you simulate. In our case, just one, like the hot fuel assembly, or if it's a region, in this case I called it mini core, but we could also call it buffer region. Yeah. Then you simulate it at the fuel pin level to get to see which are the pins that are failing. Because in DIN3D, it might give you a completely different location. It might say it's this spin that is giving you the very high temperatures. But then CTF said, no, when you homogenize everything, it seems that it's the central one that is giving you, not this lateral one, for example. You could see that from this picture.
Sorry.
Yeah.
There you go.
So here, you see here, this is a fairly homogeneous distribution compared to this. Why? Because you see all these blue squares? All these blue squares are the guide tubes inside the fuel assembly, okay? Since there's no cross-flow in DIN3D, that means that the inlet fluid temperature in the guide tube channel remains constant along all of its height because it doesn't exchange anything. While here, you can see that the temperatures of those guide tubes are roughly the same as in the other channels, but that's because the fluid is moving sideways, while in that case, it's just moving vertically.
So why is the general pattern different? Because if you take the, so if you look at the middle, there's sort of you can see the sort of boxes of 4 around, and so you have so on the left, when you have the central blue square.
Yeah.
And then there's sort of a cross of reds. And then there's sort of those.
You mean
four,
these?
Yeah, those four boxes that are
the orange.
Above. So they are, if I'm reading the scale right, they are cooler than their surrounding ones.
So yeah, but that's because the guide tubes, which are just the immediate neighbors of these two, are not sharing anything with those two.
Whereas on the left they are.
Yeah.
So that's why the general.
That's why here you go from a very high, and a very low, very high and very low values to something in between both values in there.
Okay.
Because obviously the effects occur mostly at this distance of the immediate neighbors more than.
Despite the fact that your overall value to 1 decimal place is the same.
Yeah, roughly the same. Yeah. So the distributions are totally different, while the average is roughly the same. So that means that it's when you study statistics, you've got a mean, but then you've got a deviation, and that can describe very different data.
Okay.
Yep.
What's the process of verifying these computational models? Because I assume there's not an enormous amount of empirical data.
Well, it's all available in the mentioned benchmarks. I mean, they propose you tests and several conditions, specifically the PSPT. The KAIST just gives you information about materials and geometry, while the PSPT, from the accuracy validation, is a very well-established benchmark for LW thermal hydraulics. Question is, why would you do the validation, the accuracy and the methodology validations and verifications when they are more or less known? Yeah, they're more or less known, but they're not compared between these specific 2 codes. That's one thing. The other thing is that obviously to get to the point where you're coupling everything through a coupling software environment by internal libraries, it's all a gradual learning approach. You won't start coupling the codes if you first don't know how to use the codes, and that's when you get to the at the beginning, to the accuracy and the methodology validations and verifications, where you see that if you had the right models in both codes, you could still get something close, much closer to each other. But these 2, blue and green, are not available in reality. These were just tested by the developer, but they were never implemented. But that's not the only thing. The other thing is that FlowCal does not include any turbulent mixing. As I said, the developer tested some cross-flow methods, but it's not the same, cross-flow and turbulent mixing. Why? Because cross-flow occurs both with single-phase convection and 2-phase convection, while turbulent mixing only occurs when there is 2-phase convection, because it's the bubbles, which are exchanging the location within the channels in the assembly, the sub-channels.
So this PSBT is like an established
Yeah. You've got here
surrogate model for the actual physics.
Of course.
within the
I mean, you've got here results from subchan flow. That's a code from KIT in Germany. You've got THIG, which is a code from EDF. You've got these two I'm not really so sure about. Trace, which is another American code. F-Cobra TF, which is a different version to CTF. I think it's a previous version, but I think it's a license that the French bought. Cathar, that's another French code from Grenoble. Yeah, I mean, and then you've got the University of Liverpool CTF.
So can you infer from the accuracy to PSBT, presumably PSBT has some
the reason
measure of accuracy in relation to
the
reality
reason is
itself?
very simple. The reason is very simple. One of the most sensitive magnitudes in thermohydraulics is the void fraction, right? The void fraction is perhaps one of the coefficients that led to Chernobyl. Why? Because the RBMK reactor, which was a Chernobyl type of reactor, had a positive void reactivity feedback coefficient, which means that whenever the void builds up, the criticality increases. And that's why it went supercritical, because they were doing some tests and some gas was building up, and that led to a high increase in the criticality. So that means that the void, yes, it is a very important, it's not the most important when you are coupling neutronics to thermohydraulics, because the main feedback distributions that you provide from the thermohydraulics to the neutronics are the coolant temperature, the coolant density, and the fuel temperature. The void is just a consequence of all of those, but it's a combined way of determining safety. Does that answer?
Not specifically, no, but we'll move on.
Okay.
Yeah, thank you very much, Sebastian. It's clear that you've done an absolutely enormous amount of work. So congratulations. Yeah, it seems like a really novel contribution to the field. So thank you very much. So we're going to have a 10-minute break, and then Adolphus will start our next presentations. So thank you very much.
Gonna go for the season.
Yeah, absolutely. And share the screen. Is this the one?
Oh, yeah, it's not beginning. Yeah.
There you go. So please, Adolphus is going to talk to us about fast and efficient sampling methods for uncertainty quantification in engineering.
Thank you so much, Francis. So very good morning to all of you, and I hope you have a very good break. So it's a great pleasure to share with you my PhD research topic titled Robust and Efficient Sampling Methods for Uncertain Quantification in Engineering. So in essence, there are 4 elements that comprises my PhD, namely laboratory experiments, dealing with physics-based models, learning from experimental data, And last but not least, the uncertain quantification, which we are so interested in. And these elements will be talked about in greater detail in subsequent slides. And this is the presentation outline for this morning, which coincidentally happens to also be my research structure for my PhD. And so this morning is as follows. We'll be first going through a literature review on Bayesian model updating, and follow which I'll be talking about two of my recent developments for my PhD project, namely the TEMCMC and the SEMC sampler. And finally, in the interest of time, of all my application problems I'm dealing with, I'll be going through mainly the Himmelblaus function and as application of the TEMCMC and the single degree of freedom dynamical systems with Coulomb friction as the application of the SEMC sampler. So without further ado, here's the introduction of my research topic, which namely revolves around the idea of Bayesian model updating. And it is based on the theory of Bayesian law, which is as the formula describes. And so I'll just briefly go through the elements of this equation. So you have this term of the prior, which mainly describes your degree of knowledge of the inferred parameters theta before observing the data. And this term over here is the likelihood function, which tells you the degree of agreement between the observed data and the model prediction given the set of inferred parameters that you have chosen. And this denominator is your normalization constant, obviously because distribution has to sum to 1. And this term over here on the left is a posterior, which tells you your updated knowledge of the inferred parameters after you observe the data. So this is essentially the idea behind it. And the big problem in this idea based on updating is that most of the time in literature, the posterior is never normalized and it's mostly presented in this empirical form. And because of which, you can't exactly use standard Monte Carlo approach because it requires you to know everything about the distribution, has to be normalized, you have to know the mean and standard deviation, which of course isn't known in this case. So you have to use something that's a little bit more advanced, which brings me to talk about the MCMC, the TMCMC, and the SMC in general. So details to these algorithms are found in my review paper, which I published recently. Details are shown over here. Now, however, life is never perfect, and this is true as well for all these algorithms that we just saw earlier. So one of the problems actually is mainly in the sampling from complex distributions. And I'm talking about in the context of the MCMC when sampling from a skewed distribution. So what am I talking about? Let me just give an illustrative example. Suppose we have a skewed distribution of this following mathematical form. And I'm going to use the Metropolis Hastings to actually sample from this crazy distribution. And this is the result that we actually have. As you can see the image on the right, like from this top image over here, it seems that everything is like, everything is good, life is good, like we've got everything that follows the shape of distribution. But if you look at the marginal analysis, it tells a different story. That you can see the ECDF across the both dimensions do not really agree with the analytical, analytical marginal distribution. So obviously, this is one of the shortcomings. And another problem is the lack of analysis in the acceptance rate evolution in adaptive samplers. This is something that's not really well studied. So one example I wanted to show you about the limitations of the acceptance rate moderation is in a TMCMC sampling from multimodal distributions. And as a illustrative example, we consider the 4-peak Himmelblaus function as shown over here. And I use the TMCMC to draw 1,000 samples, for example. And you can see from this top image over here, like this, for these 4 peaks, the samples obviously identify all 4 of them. However, if you look closely at one of the peak, for example, look at this part over here, you can see that the samples are not really as dense and they don't really explore the sample space as much as you should. So obviously something is not right over here. And if you look further at the acceptance rates, it tells even much more of a story. You can see that across the iteration, the acceptance rate actually decreases all the way to it's outside the optimal bounds that is really undesirable, and this actually causes the lack of exploration of the sample space that we see over here. So in summary, what we have just talked about are the following limitation. The first of which is its ineffectiveness in sampling from skewed distributions. The second, it is not robust in moderating acceptance rates. The third is that some of the samples actually require manual tuning, which can be very troublesome for especially when dealing with complex problems. And last but not least, algorithms are usually computationally expensive in some cases, especially when you're dealing with problems where you have to infer more than 10 input parameters at one time. And this brings me to the research questions that I'm trying to address in my PhD. The first of which is how do we actually improve the sampling performance for skewed distributions? How do we make sampling algorithms tune-free for the users? How do we reduce the computation cost of sampling algorithms? And finally, how do we infer time-varying parameters given the unknown Markov models? So here are the, this brings me to my research developments, my PhD. But before going through more details on which, I'll present first of all the affine invariant ensemble sampler, which forms the basis of the developments of my algorithms we talked about earlier. So this affine invariant ensemble sampler, the AIES, is essentially an MCMC algorithm that's developed recently by Goodman and Weir. And it encompasses this affine invariant property due to its use of the stretch move kernel. And because of which, is well suited to actually generate samples from skewed distribution. And one benefit of this sampler is that unlike the Metropolis Hastings, it does not require a proposal distribution, which reduces auxiliary parameters that you need to tune for the sampler itself. And just to show you how good it is compared to the Metropolis Hastings, this AIES, let's go back to the poorly scaled posterior that we just talked about earlier. And as a comparison, you can see that the Metropolis Hastings and the AIES both are able to sample from the skewed distribution. But if you analyze the marginal distribution, you can see that the AIES, the red ECDF over here, actually agrees well with the analytical solution compared to the Metropolis Hastings that we talked about earlier. And as such, we would like to actually make use of its benefits and develop this first novel algorithm, which I will talk to you, is the TEMCMC sampler. So it essentially replaces the Metropolis Hastings with the AIES for the MCMC step. And as such, as I mentioned earlier, reduces the number of auxiliary parameters to tune, thereby reducing the computation cost of the sampler. And it also incorporates an adaptive tuning algorithm to actually automatically tune the step size and the tuning parameters of the sampler. And as a result of which, users do not have to do any manual tuning and it's tune-free, which means life is good. You just need to define the prior likelihood and the number of samples, and voila, you're good to go for the sampler. And so now to just discuss the benefits of the TMCMC versus traditional TMCMC, let's consider the 4-peak Himmelblau function once again. And you can see that, of course, this is the TMCC and the TMCMC over here. You can see that compared to the traditional sampler, this results that you see over here, which unfortunately is blocked by the screen over here, actually, the samples actually explore this sample space much better compared to what we have in the traditional sampler. And in addition, you can see that the acceptance rate as well, because of the adaptive tuning algorithm, it actually is able to control the acceptance rate across iterations such that, eventually it converges towards the target acceptance rate compared to the TMCMC, whose phenomenon we just discussed earlier. So with that, this brings me to my second novel presentation in development of my PhD, which is the Sequential Ensemble Monte Carlo Sampler SEMC. And it's essentially an extension of the framework that I just talked about for the TEMCMC towards online Bayesian inference. And it's meant to be general in the sense that we can infer both either time invariant or time varying or both of such parameters at the same time. And like as mentioned earlier, it's also a benefit of it is that it has a reduced number of auxiliary parameters to compute, thereby making it more computationally efficient. And in my recent paper that I'm writing, I actually considered this time an experimental example, and it's basically on a the single degree of freedom structure subjected to Coulomb friction, whose structure is seen over here, and whose physics is, obeys the following equation of motion as seen over here. So in this experimental data, I'll just briefly go through what it actually involves. So I'll be actually collecting experimental data in this work of the phase angle difference. That's basically the displacement, reflects the difference in displacement between the upper plate and the base floor, subjected to, of course, a driving frequency. And then it has a corresponding Coulomb friction as well. And also the driving frequency data are collected as shown over here. So we'll be actually collecting 4 sets of data for this across different driving frequencies for different Coulomb friction that's being used. And essentially the SEMC sampler, we're using it to infer the time varying Coulomb friction, as well as the natural frequency of the structure, which is time invariant. And in this setup, we simulate a decreasing, we assume that this Coulomb friction decreases with time. In this setup, as you can see, as the time increases, then the friction actually decreases. However, in reality, we never know how does it decrease, or rather what form of decrease does it take. And this itself presents a model uncertainty problem. And as an example, I will just present 2 Markov kernels used to describe the evolution of the Coulomb friction against time. And so T1, the first model, assumes a linear decrement, and T2 assumes an exponential decrement. So in this work, we actually propose the use of the evidence term, which is the forgotten protagonist from our first slide, if you remember, the evidence term to actually rank the suitability of the Markov kernels given the problem, and from which this actually justifies the use of the SEMC because it is also an algorithm that's able to generate the evidence as a byproduct itself. And this is the results as seen over here in this bar plot. You can see that as the iteration goes by for each of the time step, because there are 4 time steps considering 4 different decrement of the Coulomb friction, you can see that as the time goes by, this is the log evidence value. We're working in the log scale, shows that as the iteration increases, you can see that it favors more the first model. You can see this is less negative compared to the second Markov model, which tells us that obviously the linear decrement is the more probable characteristics of this the decrease in the Coulomb friction. And so moving on, this is the results that we obtained from the estimates of the Coulomb friction and the time invariant frequency. So this on the left is the results that we obtained accounting for the first Markov model. And this second is the results that we obtained accounting for the second Markov model. And you can see that both of them, under both scenarios, both of them are able to sort of infer the time varying Coulomb friction. However, the only difference is that you can see the credible interval is narrower compared to if you were to use the second model, which tells us, which is the benefit of this investigation, that if you pick the right model, you sort of also are able to obtain estimates with better precision. And in addition to this, we have also seen that for whatever model that use the estimates of the natural frequency of the structure also converges towards its true value, which is exactly what we want. So this is exactly what I meant when the sampler is able to infer both time varying and time invariant at the same time. So now we've seen what has already been done. Let's look towards the future as to what exactly we're going to do moving ahead from here. And I have 3 different pieces of work that I'm currently working on. So the first of which, Project ProMap, in which the aim is to devise a probabilistic artificial intelligence model for the prediction of material properties, in short, ProMap, and involves the merging of the AI tools together with UQ tools. So for example, the SEMC and the IPM, which we just talked about. And the second work that I'll be working on will be the prognostics health management with scarce data. So in this investigation, we seek to actually quantify how much data is actually deemed sufficient to actually perform online prognostics health management for a nuclear piping that's subjected to fatigue stress. And finally, the third project is prognostics health management with a piecewise model, which I think is the most interesting. We seek to actually validate the model selection capability of the SEMC in identifying, in this case, for piecewise model, there are different submodels, and how good is the SEMC sampler actually is in identifying and selecting the most appropriate model for each of these submodel regions in this work. And eventually this will be applied to actually a creep growth stage model for online updating of this creep growth information for I think it's a steel component, for a passive nuclear steel component in a advanced reactor. So essentially this is what it is. And so to actually summarize this morning's presentation, we have actually first of all looked into the context of my research, which I gave a brief review on the Bayesian model updating. And we've also looked into what has been developed in the past. Okay, so we've actually reviewed the existing techniques, sampling techniques plus the shortcomings, as well as presented the tools that I developed, the SEMC and the DEMCMC, plus the results that are obtained from these samplers. And we've also looked at what we've done at the present, which is the ongoing research plan focusing on online prognostics health management, and we saw in the previous slides. And by now, some of you might be wondering, what does the future hold for me at this point? Well, like what any other of us final year students are going through, thesis writing, first of all, and hopefully, fingers crossed, graduate from there. And if all goes well, I'll be starting my new job as a research fellow, and none other than the National University of Singapore and the Singapore Nuclear Research and Safety Initiative, to whom I would like to give special acknowledgement and thanks for their gracious funding in making my PhD studies possible. And with that, I'd like to end my presentation by presenting my contact details, and I thank you all so much for your undivided attention this morning.
Thank you, Adolphus, for a really clear and poignant presentation. Really well done. Does anyone have any questions from the audience?
Is it just a stupid physics question in this case? By Coulomb friction, in this case, you mean Coulomb force or the Coulomb permittivity?
Oh, as in the friction that's due to the Coulomb force itself. The normal contact force that's due to the Coulomb. Newton, yeah. Based on Newton's law. Yeah.
Does anyone else have any questions from the audience?
How come you've got Squid Games on your car?
Why not? I give a name card, so that's a reference from that show. Yeah. Nice. I actually was hoping someone would spot it. Yeah.
The fact you've got the workouts on your website as well.
Sorry?
Nice.
Yeah, or you can send a QR code. It takes you to my website straight away. You can see all my research works over there.
Does anyone have any questions from the Zoom participants at all? No? Any last questions from the audience? And if not, let's thank our speaker again. Thank you very much, Phil. So, let me just double check. So our next speaker is Irma. Let's come to the stage. And I think we have your presentation. Which one was it? The PowerPoint one?
Okay.
Okay, close that. Okay.
Okay,
Perfect.
so yeah. What I will present today is the first section of my PhD project that I called model reduction and stochastic updating of a vibrating system.
Sorry.
It's not working.
I don't know why it's doing that.
Okay. Okay, the aim of the overall project is to build a framework for model reduction and stochastic updating of a vibrating system for industrial application with the purpose of converging the model output on the experimental results. In fact, in practical application, usually you have two big groups of data that don't match each other, that are the analytical results, the finite element results, and the experimental results. And the only way to have a match of these two groups of data is to change the modeling assumption or the parameter until you reach the convergence that you need. What we want to do is try to define the probability density function of this uncertainty to match these two groups of data. For doing that today, I will present the application of the global sensitivity analysis to reduce the number of model inputs, and then the implementation of a model updating with the purpose of converging these two groups of data. What I will present is the framework that I developed, the experimental setup, the global sensitivity, and the synthetic data. Unfortunately, with the pandemic, it was impossible to go to the lab, so I used this stage synthetic data that I managed with kernel density estimator, the stochastic model updating, and then the conclusion. My framework is very easy. In the first level, the aim is the application of the global sensitivity analysis with the purpose of reduce the number of inputs. And for doing that, I need to define the quantities of interest and the inputs. Then, using the reduced number of inputs, I can build again a reduced order metamodel that is used to apply the updating metamodel. Then, as output, I will have my probability density functions that is used to rebuild again the metamodel with the new uncertainties. This is my experimental setup, are three masses, so 3 degrees of freedom that are connected to the ground with 3 springs, and they are connected to each other with a coupling springs. The coupling springs are formed with 2 plate-like springs that are connected with a rigid element that can be moved up and down to change the stiffness of the springs. In this way, I can add uncertainty to the system, and I know which uncertainty I add to it. Working with dynamic system is easier from some point of view, because if I can define analytically my mass, stiffness, and damping matrices, in this case, the damping matrices is proportional only to the stiffness matrix. This because define the damping in all physical systems, especially in dynamic, is very complex. So usually
for simplicity, you consider the damping matrix as proportional to the mass or stiffness matrix or a mix of them. Or you consider it directly constant, especially with you have complex system, the damping is constant, is a number for all the procedure that you need to do. Through mass stiffness matrix, I can define eigenvalues and eigenvectors. That through them, I can reassemble and restudy completely my system in a very easy way, because the eigenvalues define the natural frequency of the system. That is the frequency which the system tends to vibrate if it isolates. So there are no external forces to it. And the eigenvectors rebuild the motion of my system. So through this, I have all the information that I need, that is a vector and a matrix. So it's super easy. So this, you can imagine, I use the three eigenvalues as quantities of interest are the easiest way to define the quantities of interest. And then for the inputs, I have only 8 parameters. My system is very easy. And so they are the 5 stiffnesses and the 3 masses. Of course, for some of them, I have a very good knowledge, like for the 3 ground stiffnesses and for the 3 masses. Instead, I synthetically added an uncertainty to my 2 coupling springs that are these 2 springs. In fact, if you see, is the only distributions that have not the nominal values as the mean of the distributions. The next step is the sampling. I sampled, of course, my inputs for applying the meta models that you can say at this point. Why apply the meta model? The system is so easy. You have the analytical model, and this is only because polynomial cross expansion gives a very easy way to calculate the Sobol indices that are used for applying the global sensitivity analysis. At this stage was only for this point. Of course, in industrial application, your system is so complex that you need a meta model for going through all the process. So the next step is the last step of the first level of the framework. That is the calculation of the Sobol indices that quantify the input influence on the decomposed variance of the probability distributions on the outputs. As you can imagine, my attention goes to my 2 coupling springs that are these green and these blue elements on the pie chart. Here I'm showing the total order. But I was lucky because my first order and my total order of the global sensitivity was equal. So it means that there is no interaction between the system. Of course, this depends by how I define my the distribution of my inputs. These are some results that I can comment with on this slide. As you can see, the second and the third eigenvalues depends mainly by a single element that is different. The second eigenvalues is influenced more by the first coupling springs, that connects mass 1 and mass 2, and instead the third eigenvalues is mainly influenced by the springs that connect mass 2 and mass 3. This is important because my inputs are independent, so I can say that also my 2 eigenvalues are independent. That is very important for the next step of my framework. In fact, now I need to take 1 second to explain you how I manage the synthetic data. Sorry, that seems complex, but it's not, I swear. At this point, the main task is to rebuild the uncertainty distribution that I have, that I forced to the system at the beginning. And for doing that, I used twice the kernel density estimation. One to recreate the bivariate probability density function, bivariate because my eigenvalues are complex. So the real part and the imaginary part are considered as correlated variables. The bivariate PDFs are sampled for applying the stochastic model updating and then estimated again my initial distributions. So here is my synthetic data. This I use frequency response function, of course. The green lines is the nominal system. Instead, the pink line is my experimental system. As you can imagine, I used as uncertainty parameters only the two coupling springs, and this FRF is with the mean of two uncertainty parameters. You can see in the picture, but also on the table, the main difference, the main difference are in the second and the third eigenvalues, hopefully, because it proved that my global sensitivity analysis was right. So I continue to consider my uncertain parameters. Now I apply the kernel density estimation. The kernel density estimation is a non-parametric way to estimate the probability density function, and the application is very easy because for each sample of the SAT, I smooth its influence around the region, and then I aggregate again all the contribution for obtaining my probability density function. This is my results for the second and the third eigenvalues. As you can see, the probability density function, the bivariate probability density function are perfect because my data are synthetic. In fact, now for simplicity that I'm using real experimental data, at this stage, I will use univariate probability density function with only the natural frequency, because the damping is impossible to correctly optimize at this turn. So the damping is constant on my next part of the project. So as you can see, there is also a big uniform element at the top that is okay. It was expected because my uncertain parameter is uniform, as a uniform distribution. Now I apply, the next step is the application, and last step is the application of the stochastic model updating. I applied this in an inverse way because my solution will be the structural changes that are necessary to apply to the system to define, to match my analytical data with my experimental data. Usually the direct way to apply it is I gave the modification to the system. As output, I have my eigenvalues. Now is the other turnaround. So I apply the Woodbury formula for obtaining my characteristic equation, and then I solve it with in a numerical way because it is non-linear. Here are the two elements that I'm interested on, that are my solution of the equations, that are the two uncertain parameters. Maybe it will look strange for you because it's in modal coordinates. I use everything in modal coordinates because it was easier, the application. Modal coordinates, it means that I use the eigenvectors for define the position of my modification. It's quite easy in dynamics to apply it. I apply the stochastic model, the characteristic equation for each sample of the SAT, and then I use again the kernel density estimation for obtaining my results that are the green lines is the kernel density, the probability density function that I obtained with kernel density. Instead, the pink line is my original PDFs. The mean is got very nicely. I have some problem with the variance, but it is normal. I managed and the data so many times that is normal that I have some discrepancy in the variance. So at the end, what I showed you today is the application of my framework for the synthetic data of a 3 degree of freedom system. The reduction of the inputs was quite was a success. And also at the end, I got a close agreement between the generating parameters and the estimated probability density function. The next step, that is something that I'm working now, is the application of the same framework with my experimental data that I got during this time. And the next step will be the application of this framework with a real industrial application, hopefully, if I will get the data at some point of my life, or hopefully before the end of this year. Okay.
Thank you so much for your presentation. Really wonderful. Does anyone have any questions from the audience?
Yeah.
Hi. I have a question about the empirical data.
Yeah.
How you how does your methodology change when you got empirical data? You've doing everything with that.
Yeah. No, please. No, I'm doing everything with eigensolution, so eigenvalues and eigenvectors. Yeah, perhaps an easy way to represent my system, but
how does it change when you're empirical data?
Nothing, because what I showed.
Sorry.
I don't know. The only thing that changed, okay, the change here is that you have not this box, but all the other process is the same.
So I mean, how do you decide the structure to get that nice?
Okay. I started with the hammer test and the accelerometer for collecting the data. I don't know if.
I mean, is it like impact excitation?
Yeah, it's an impact excitation.
White noise.
No. It's impact excitation because we moved the dynamic and I lost all the stinger for the shaker, so it was easier to use the hammer test. But in industrial case, usually you have accelerometer for collecting the data and big shaker for exciting the structure.
Just quickly related to that, so how do you then use this? How do you extract the?
Okay, sorry. Now I got your point. There are some tools that Siemens provides. It's called Polymax. And from the apparatus, you can collect the natural frequency then. Yeah.
Oh, sorry. Nice one. Good job. So, stay on the slide. So, I see you're using kernel density estimate. So, this is just mainly like a suggestion. Maybe you might also consider this of a staircase density function. There's this thing. There's also a method model tool that's used to estimate distributions based on the moments. So it basically requires the information of the
yeah, that is an option.
Sorry?
That is an option, of course.
Yeah. And you can also do inference on it as well. They get e-boxes and do some mandatory or that kind of considering quantification as well. So, yeah. But good job. Nice one.
There's a question for you from Peter as well. If you'd like to unmute yourself, Peter.
Can I ask a question, please?
Sorry, let Peter go first and then we'll come to you afterwards.
Cheers, Francis. Thank you very much for your interesting talk, Irma. Even though you pointed out in the beginning that you're using a constant damping matrix, I would say that the real interest of industry is to do with uncertainty quantification about damping, precisely because of the difficulties that you kind of mentioned. Are there any adjustments to your framework to make it suitable to enable people to work with damping problems? Because that's very tricky, as you say.
We didn't think about it because the main we focused more on defining the uncertainty distribution between the analytical data and the experimental data. And Airbus, that is my industrial partner, was more focused on this problem than the damping approximation. Of course, it's an option. I don't know if it's applicable because usually the problem with damping is in experimental data. It's so complex, have a good approximation of the damping on your system that you know very well the type of damping, also because the damping usually is related to nonlinearities. So it's complex to think this type of framework for damping approximation or damping selection.
Okay, thank you.
And then we have another question from online. I think it was Mihu that wanted to ask a question.
Okay. The damping coefficient beta, what is value used in your mode updating procedure? Is it experimentally determined?
I tune it very easily. The data that you see is tuned with my experimental data. I got some linear testing on my system, and I tuned the value that you saw, and I tuned also beta, because we are lucky. Our damping is very, very small in my system, and is proportional to the mass and stiffness metrics. Is a number that I tuned. There is no any type of approximation on it.
Well, even this damping value is low. It can be a considerable source of uncertainty. So if it's not considered in your updating procedure as an uncertain parameter, I'm afraid the results may not be excellent.
Not so sure, because I have already applied the framework for real experimental data, where I consider the damping constant as the mean of my experimental damping, and I got really nice results. Of course, this is a big approximation on the damping of the system, and for a real industrial case, can be tricky. Maybe say, okay, the damping is constant and is okay. For my setup, is okay, because the damping is very, very small. I built it for being very small in damping, so for now it's okay, this big approximation.
Okay, I have another question.
Absolutely.
Concerning the use of Woodbury formula, you use the determinant, and your example, numerical example, well, it's also the model of the experimental structure has very low degree freedom, 3 degree freedom. So using the determinant would be okay. But if you have a large number of degree freedom, and the formula, from my own experience, I also studied mode updating, stochastic mode updating as well, and the results would not be good. There are other ways of doing this.
Yeah, of course. In fact, you are right. Woodbury formula is nice to apply when your system is simple, then could be a mess. In fact, for the next iteration of the framework, I use the sensitivity method. That is another method for the updating that is very easier to apply, because what you need is only the eigensolutions of your system, and then you need to tune the weighted metrics on this the sensitivity method. So I change a little bit the framework that I'm using now, especially for that reason.
Actually, the Woodbury formula is okay. It's good. Actually, the determinant, using the determinant, you have a formula shown. That won't be good for a large number of degree freedom for a system with larger than degree freedom. Woodbury formula still applies well if the number of updating parameter is small, but the problem is the determinant.
Okay. Yeah. No, I agree with you. The problem is how you determine the characteristic equation. That can be tricky when you have a big number of degree of freedom.
Okay, thank you.
Do you have any more questions from this side of the audience? If not, I think Peter might have another question.
Okay.
Sorry, I mean, Francis, I'm happy to, and Nirma, I'm happy to take this offline in the interest of time, but
you have 5 minutes if you want to ask one more, and then we'll move on to Enrique.
Oh, okay, perfect. So I was just curious about this follow-up from Professor Young. He is right about this the size of the damping, and I am wondering whether your agreement that you saw between experimental and your framework was just not calibration, whether it was not confounded. There's no confounding between the validity of the results. I'm trying to restrain myself from talking about validation and calibration. Do you think you kind of calibrated with your available data, and then you thought that your results are good based on this constant damping proportionality constant? If that makes sense.
Yes, the problem, of course, that I'm doing the task. So another problem with real experimental data that can be complex, collecting a lot of data. So what I'm doing now is I collect like 70 experimental data, and then I managed to create more experimental data for applying the first step of the kernel density. Yeah, that is an option. Of course, is something that we are thinking about. The main problem is now that I'm waiting Airbus for having a real industrial application and seeing what I have at that point. An option is the calibration. Another option is working directly on the linearization problem, because I think that the system will be nonlinear. So I'm waiting. Now I'm waiting.
Okay.
Just a follow-on comment, not a question. If you could share slides and some written form of your framework, that would be very much appreciated, so that we can carry on the discussion.
Yeah, of course. This part of the PhD is published in ICAS, because I presented it at the ICAS this September, last September. And yeah, I'm writing a paper right now about this. So okay. I'm happy to send you what you want.
Awesome. Good luck. Thank you.
Fantastic. And Professor Miku left another comment saying, using the Rayleigh damping model and an average beta value would introduce considerable unknown level of uncertainty.
Yeah, I know.
Thank you very much for your talk. So next up, we have Enrique on approaching sensitivity analysis with intervals. So bear with me a second. Can everyone see that okay? I hope so. Okay, no comment. I assume that's good then.
Shall I start?
Yeah, please.
Yeah, so I'm going to talk to you about some preliminary work that me and my colleagues and Marco and Edo have been doing on sensitivity analysis. So first of all, what is sensitivity analysis? Let's assume we have a model that takes an input and gives an output. And after measuring the uncertainty in the output, we want to understand how the different sources in the input affect this output uncertainty. This is the traditional definition by Saltelli et al. And Applications of sensitivity analysis are many, but Irma just showed one of them, which is model reduction. So we can also use sensitivity analysis to make informed decisions for research and development. So let's think that we have a model that represents a physical system, and we want to improve the response of that system. So with sensitivity analysis, we can drive research, we can prioritize the different development of the research. So how is this typically done? There are different ways of performing sensitivity analysis. There's the derivative-based approach, which tries to compute the derivative of the functions of the model, either analytically or numerically, and then they perturb the inputs around a base point to study how the output is affected. There are also distribution-based approaches like the one Irma used, Sobol indices. They compose the output variance and they assign it to the inputs variance. So how much of the output variance can be apportioned to the different variables. There is regression-based approach. We can perform linear regression, and then we can use the coefficients to rank the parameters by importance, or we can fit a machine learning model, a meta model. And there are other approaches which are usually a combination of all of this. So some limitations. In the case of derivative-based, in some cases we need the analytical function. We also need to define base points for each input, and also we have to define a perturbation size. In the case of the distribution-based, the output distribution function is dependent on the input, on the distribution of the inputs. And sometimes the input distribution is not always known. And in the case of the regression-based, we have to make prior assumptions about the model, if it's linear, if it's a polynomial. And also the quality of fit can introduce further inaccuracy. So what's the problem then? The problem is that in mathematical models used in engineering, science, economy, policymaking, then sometimes the analytical description of the model functions are not always available, either because we're working with a black box or because there are many, many functions that are dependent with each other. This is what's more common. Usually there isn't a consensus about the base point of the input parameters, or there are no sound assumptions about the distributions these inputs follow. And also sometimes we don't know about the model behavior. We don't know if it's nonlinear, if it's non-monotonic, etc. How can we solve this? In this paper, Helton and Davis, they say that the simplest sensitivity analysis procedure is an examination of the scatter plots associated with individual sample variables and the particular model prediction under consideration. So in this case, we have an example. We have a function which takes two inputs, x1 and x2. And we can see there is a linear dependence of y with x1, but there seems to be no dependence of y with x2. This is very clear from the scatter plot, but is there a way of measuring this intuition? So the answer is yes. We can use intervals to quantify this. So in this example, we assume that x1 and x2 belong to the -5 and 5 interval. And we can measure the areas shaded in blue by subintervalizing the region, the interval. And then we can compute the sum of the area of the subintervals, and we can divide it by the total area, which is the area formed by the maximum and the minimum of x and y. Let's say it's the biggest area possible. So we can see that the greater the area in blue, the least important that parameter is. Because here we can see that this area, the area shaded in blue is way smaller than in this case. For this example, we have that the sensitivity index of x1 is 0.88, whilst the sensitivity index for x2 is 0.064, which means that x1 is the most important parameter, as y seems to be unaffected by x2, which is true because I made up this function and x2 is not present in this function. So this is right. If we go to a more sophisticated example, we can do this with the Ishigami function, which is a well-known function in the UQ and sensitivity analysis community. And in this case, there is some discrepancy with the true total subtle indices respecting the index of x1 and x3. But this is because in this case, the true total subtle indices are calculated by assuming that the x1, x2, and x3 assume like they follow a uniform distribution. However, in the interval-based case, we are not making such assumption. But they both agree that S2 is the least impacting parameter in the output. A very nice byproduct of this method is that it also gives us the information of a global pinching sensitivity analysis. So pinching sensitivity analysis consists on reducing the input interval to a single value and then calculating the variation in the output interval. So how much the uncertainty in the output has been reduced by reducing uncertainty in each input. So in this case, we can see that in the case of x1, the reduction in y is maximized when x1 has the value of -pi, pi, or 0. Reducing uncertainty in x2 has the same effect on y across its entire domain. So it doesn't matter where you pinch x2, you always get the same output uncertainty. And in the case of x3, is shrinking its interval from -pi to -pi to -1,1 is the second best option if you cannot pinch to a single value. You can only afford to make reductions in the interval, not just a single value. So the conclusion is that analytical description of model functions are not always available. With this method, you don't need analytical description because you can just make a propagation of the samples. No consensus about base points or perturbation size. You don't need to define any base point or any perturbation size. Unsound assumptions about input distribution functions. You don't have to make any assumption about distribution functions here, only define the intervals. Unknown model behavior. You don't need to make any prior assumption about the model behavior. And also it provides you useful information for model calibration and decision making. So yeah, that's it.
Thank you very much, Enrique. Do you have any questions from the audience?
Yeah,
Dominic?
I think I've got 4 little ones, but you can just pick which ones you want to answer out of 4, because they might be me, I'm not sure. So the first one is you've shown some one-dimensional examples. Does it apply in bigger dimensions? The second one is what do those sensitivity indices or values that you get out actually mean? Third one is you don't make.
Sir, can you repeat? I was thinking about the first. So
sorry. What do they actually mean? So you showed the sensitivity indices and you compared to the Sobels. So you got those S and you got the 3 values or the 2 values. Yeah. What do they actually mean?
Good question.
The third one was you don't make any consideration about the density of the output samples. So in situations, if we take the extremes where we might get one point that's on its own 1 million miles away from the rest of the data, what does that? So what does your method tell us then in those sort of situations? I think just those 3 will do.
Okay, so I start by the third because I forgot the other 2. So
okay,
regarding the density. We are not actually looking at densities, so we only care about the maximum and the minimum output. So what is inside, I mean, if you have the extra information, that's great. But the whole idea here is that you cannot infer that density is the actual behavior of the model. So this is suited for cases where you cannot make such assumption. So let's say you have an interval. So whatever is inside, we don't really care. We only care about the bounds of the interval, like the guaranteed response. If you have more information, if you have density, if you have a distribution function in that interval, that's great. You can use other methods like Ensemble because that's what they do. But so we don't use that information.
Okay. So if you answer what they mean first, and then you can tell me.
That's a good question. I don't really know. So,
sorry.
So if I try to think what this little area means, I don't know actually. So that's a good question.
Okay.
I only know that if the whole area is like if these two areas are equal, then that parameter, so the response function is independent of that. There is no dependence.
Okay.
That's what sort of we're measuring here.
And so what would happen if we take that graph on the left, and pick any one of the columns, we add a point really far away, so you get one big line in the middle. Does it still work then?
So one big line
So
in the
if
middle.
there was one point that was really far away from the rest of your data, so you get one of your rectangles that's really, really long compared to all your.
Yes, I think it's required to be continuous in the interval.
Okay.
So the function has to be continuous in the interval. I think so, yes.
Do we have a question from Peter as well? Or?
And for higher,
Sorry.
higher dimensions. So the point is that when you use a scatter plot, you don't do like, because higher dimensions would take into account the dependence of
So if we had two
x1
dimensions, for example.
Well, here we have it's a two-dimensional problem. You have x1 and x2.
And they're the inputs though, right? So what about if we have y1 and y2 as well?
Yeah, then you have a sensitivity index for y1, and then you will have another sensitivity index for y2.
Okay, great. Do we have a question from Peter as well? Was that your hand raised from the previous talk?
I think I left my hand raised, but I can use the opportunity to ask one question anyway.
Please go ahead.
How do you, or are you aware? Have you done any experiments to move towards correlated inputs? I mean, there are some developments for Sobol, for the Sobol framework to kind of take into account correlations, but we know that intervals are inherently unable to take into account. So, any thoughts on that?
Yeah. So two problems here. If you calculate this by sampling, then it's the same case as the Sobol. You have to find a method to create correlated samples, maybe using iCopula. But if you perform interval arithmetic, you can take the dependence into account, because Ander is working on a method to perform interval arithmetic with dependence, with bivariate dependence. So we can apply that to this case. So we can perform sensitivity analysis with the dependent inputs as well. So it's possible.
Do you mean the zoning method?
Say again, sorry.
Maybe that's a question to Ander. I was asking if that's a zoning method.
Yes, yes.
Okay. And in that case, how would that work? Do you know in the case of higher dimensionalities?
You mean in terms of computational time, or
in terms of implementation? Because I've had several discussions with Ander, and the zoning becomes a bit unwieldy in higher dimensions.
Yeah, then it's a shared problem, I guess. Yeah.
Okay. Yeah, very interesting. Very interesting. I would also ask you to share that research if you don't mind.
Oh, this is all I have. This is basically all I have so far.
Feel good. Thank you. Thanks. Excellent.
So I think Ander wanted to say something.
Yeah. So his inputs here are just a box, right? It's like a two-dimensional box, but he could start with any set. It wouldn't have to be two-dimensional. It could be any dimensional, essentially, just any set in any dimensions, and it would probably still work. So.
Sure. Okay. Good. Thank you.
Alex, do you have a question?
Yeah, following on from Dom's point before about like having throwing an outlier point on one of these intervals, is there any way you could take into account, given like the sparsity of the scarcity of data, how wide those intervals should be given the data that you've actually observed, and take like confidence limits on these structures and get like a confidence intervals for the index?
Sorry, I don't think I follow.
So like basically, so these intervals are drawn, so you've been the x-axis, yeah?
Yeah.
And then you just, in each of those bins, you draw an interval from the max to the min.
Yes.
Within each of those bins.
Yes.
But obviously, if you draw more and more data, you might eventually start finding points that exceed those maximum mins, and you'll gradually start approaching the true interval that should be.
Yeah, so you here we have 20 subintervals, so you can increase the number of subintervals, so you can make them.
Yeah, but if you were to do so, you would have, like, you could eventually get to a point where you have intervals that only have 1 point in them. And could you use like a confidence approach to take into account the fact that these intervals have a limited data set within them?
You wouldn't get to a point, because there's some. If you get to a point, it means that it's deterministic, and if it's deterministic, then this area is 0. So if you get to a point, it means that y is completely determined by that variable. So this is 1. So
yeah, but like each of those intervals has to have, like, unless I'm misunderstanding this, so each of those intervals, when you draw that, it has to. Each of those bins needs at least 2 points in.
Yeah.
Otherwise, the interval is just a singleton.
Yeah. But if it's just a single term, then it does, that area is 0.
But it's a grouping methodology, isn't it? So there's always the assumption that you have to select your group sensibly. If you've only got 10 data points and you select, I want 10 groups, then it doesn't work. So you'd have to say, okay, you need less.
Yeah, but you could find some approach, given the fact that you've only got 10 data points. Could you use a confidence-based method to estimate what those intervals should be, and then find out what binning method would give you the best kind of approximation of the appropriate index? Maybe. But I don't actually know. It's just.
Yeah, I don't know either.
There's no sampling. It's just the validation.
Yeah.
Well, no, but these are intervals based on samples.
Not necessarily, but it depends.
You can
Oh,
do
okay.
both. You can
Yeah,
do
but
both.
like in this case, these are based on samples, aren't they?
In this case, it's just pure interval arithmetic, no samples. I just used this to show like the scatter plots, but I've calculated this with the analytical function and with interval arithmetic.
Ah, okay.
This is
Apologies.
interval arithmetic.
I thought
And-
these intervals were based on the samples that you were showing in the previous slide.
No, but you can do that as well by doing some sort of integration. So it's possible to, yeah. So it's possible to calculate the error in the integration as well.
Okay.
Yeah, actually, these sensitivity indices were calculated with samples, not with arithmetic. But yeah, it's possible to do it either way. So if you have the analytical description of the function and you can do interval arithmetic, then you can get the rigorous areas. If you don't, then you can do sampling and still calculate the area.
Yeah. Okay.
So we're just going to move on to our final question. Professor Mehu, would you like to ask your question? You have your hand raised, or perhaps not. And if not, then we'll move on to our next speaker.
Sorry, can I ask a question? Yes.
Yeah,
I wonder if there's any serious work on a fair comparison of uncertainty quantification of probabilities approach and the interval approach.
I don't know.
In a probability approach,
yeah,
there are always points even beyond the 3 sigma, right? 3 times standard deviation. And if you take an interval approach,
yeah,
you need to decide the lower bound, the upper bound of the parameter. So what the range of data to be included.
Yeah.
And if you do that, say if you 2 different persons doing the same problem, uncertainty quantification, and one takes the probabilities approach, and one takes the interval approach. So how the interval approach guy, take the range of data, would lead to a fair comparison of the results.
Kind of a false question though, isn't it? Because they're both attempting to do quite different things. If you want to be absolutely sure that you've definitely got the most rigorous bounds, then you'd use the interval approach. If you're trying to make some prediction or estimate of a parameter, then you might use the probabilistic approach, trying to compare the two and then saying one of them might be wrong or one of them might be correct in any particular circumstance. Depends entirely on which question you ask.
That's true.
I think.
Or you can take like a possibilistic approach or something, use the facts, like use a structure rather than just an interval, and propagate that structure through the function that allows you to draw an alpha cut in the final function.
Use a table.
Yeah, exactly.
Okay, thank you.
Okay. Well, thank you very much, Enrique, for a fantastic talk. Let's give him another round of applause. We have 2 speakers left. Our next speaker is Noémie Lecarrier. So if you'd like to, would you like me to share the slides, Noémie, or would you like to share it on your friend?
Maybe it's better from your side.
Okay, just let me know when to change the slides. Hello. Hold on, sorry, I'm just getting your slides up.
Francis, if Naomi shares though, then she could just change the slide when she wants.
She doesn't, she wanted me to do it.
No,
So.
it's just as you want, but no, okay, I will do it from my
Okay.
Okay,
Fantastic.
but I don't know. Wait 1 second.
If you have any issues, just let me know. But you have sharing permission at the moment.
Because it's the first time I use Google Slides, so no, I have to share my screen first.
You have to share your screen first. It's the green button.
It has been a while. I have not done that. Share screen. Okay, and then.
And I'll make sure to spotlight you so it doesn't move on to anyone else.
And why doesn't? Okay. I don't see my. Yeah, it is. Okay, share. So now you see it. Yes.
And we do, and I'm trying to get a little bit
slide.
bigger as well.
So do you have it?
We do.
Yeah.
Yeah, perfect.
Okay, and this on the side. Okay, 1 second. Okay, perfect. So nice to see you today. I will introduce you to some add-on to Gamels, to an R package called Gamels for univariate distribution fitting with regression of the parameters on covariates. And I did some add-on to this package that may be of interest for you. So it's not really about imprecise probabilities or interval things or like really quantifying uncertainty of uncertainty, but it's more about just making something, just dealing with extremes in a more general way. So you will see. Yeah, and just it was done in the University of Ca' Foscari in Venezia, and now I'm in Brittany, in a university in Brest, in the Western Brittany. Okay, how do you? Yeah, so this is the context. So this is a map of Brittany. You have like 91 weather stations, and we record the precipitation every 6 minutes in millimeter in each station over 3 years. And we turn it into hourly precipitation, and we keep every third measure in each station to ensure some time independency. And we want to model the precipitation distribution, the hourly precipitation distribution in over all station. And basically, we would like to have a field of the precipitation, precipitation fields over Brittany, and to assess the non-stationarity of this field, like spatial and time, in space and in time. And for instance, we would like to assess how the extreme behavior, like the tail of the distribution, change over time. Do we have more extreme precipitation, hourly precipitation with years passing by or no, and where in space in this region? So we have just 3 years of data, 2016 to 2018. And for that, so we could use a fitted distribution, a model I will show you later, that include both small, intermediate, and extreme values, and fit it in each station. But we find it more interesting to fit the same model over all station at a time, over all time at a time, and regress the parameters of this distribution over covariates that are time and space. So for that, this distribution is called the extended GPD, the extended generalized Pareto distribution. So it's given, sorry, there is a bit of text, just read the red square. The F function is the CDF of this distribution that models simultaneously small, intermediate, and extreme values with a special attention to extreme values. It's better than a standard gamma distribution for a gamma model, for instance, but we keep the number of parameters low. We have only 3 to 5 parameters depending on the model of the G function that you can see in F. G is another CDF that we have to choose. So we have several parametric models, and we can define more as long as they satisfy some conditions. And so basically the CDF of this extended GPD combines the CDF of, G, a CDF, a parametric CDF, and the generalized Pareto distribution H of Xi. And in the end, so Navo et al., the statistician who proposed this model, who wrote this model in 2016, said we found 4 parametric models for the function G, but you can have more as long as they satisfy some conditions. And in the following, we will just use the first model because after a lot of testing and also a few other papers who have used it, it's the one that is the most robust for parameter inference, and that has the least number of parameters. So it's quite interesting. So just an example of the resulting density. So this is the density of F, so the global density of the precipitation here, of the variable of interest. And for G in the case 1, this case, the red case, and you see so you have this parameter K that I called mu in my last slide, but this plot is not mine. And so you see how, depending on the value of K, you can either get the standard general Pareto distribution, or get closer to the gamma, or have things with a larger tails. Here, yes. So how do we, now the question is, how do we use this distribution over space and time? For instance, how can we, given field data over space, over time, fit distribution, but with parameters that can vary with time and with space? So for that, we will use the package camels in R that is designed specially to regress distribution parameters of well-known parameter distribution over covariates. And in fact, the contribution of this talk and my work there was to create this add-on for the extended GPD distribution. And now I will show you, and yeah, so you can find it at this, if you are interested to use it or to test it, you can find it here and make some comments because it's quite new. Now I will show you some just results. Just check the time, yeah. Just some results to illustrate the potential of this thing and also its limitations. So in the following, we call mu sigma nu because it's a standard notation in the Gamels package. The 3 parameters of the extended GPD distribution that is presented before. So mu is the shape parameter Xi. Sigma is a scale parameter, location parameter is 0, yes, and nu is the parameter of the CDFG in the first model GPD that is described before. So once you fit the model and you say, okay, my covariates are latitude, longitude, and you use penalized splines to regress the parameters smoothly over these covariates. And also year sometimes, or months, and then you impose the cyclic splines. So you can get this, so once you feed all this, you can get this type of first result, so the box plot of the evolution over all station of the mu sigma nu parameters over the months or over the years, because we have not a lot of data, we either fitted over months or over year plus spatial coordinates, but never months plus year at a time. This can give you maps. Sorry for the color scale, it's a bit basic, but it is. And then you can, when you know the weather type, there you can, it's quite coherent because depending on the more or less Western, you will have slightly different behaviors in the precipitation. You can take some areas of interest, for instance, the western part where mu is relatively lower than the rest, than the rest of Brittany, the north where it's relatively higher, and the south where it's intermediate. Then you can follow the parameters over the months, and then you can so here, here you have an illustration also of the importance of censoring the data when you use this distribution, because we realize that if we include the very small data close to 0, so 0 is a minimum bound for precipitation, but it's also how do you say, you have a lot of measurement error and imprecisions for close to 0 data, and we improved significantly the QQ plot and results, fitting results, when we censor them below 0.5 millimeter. So we would just remove them. So this it was observed in a few other applications. And now I just develop on one problem, not one problem, some a limitation. So we fitted for these 3 stations of interest over different months the CDF. So here it's in the summer period, the CDF, so no censoring. So okay, we see that it's better with censoring, but beyond that, what struck us is that we didn't have any difference in the CDF fitted. So we had difference for different months, but not difference for different stations, even a bit extremes at the same months. So we wonder if it was because we had not enough data, so maybe the difference in the histograms were kind of overrepresented, or maybe because the monthly variation was much bigger, we only captured it with the global fitting. So we so it's the same plots, but for the winter season. So we did some investigation. We did some clustering to have more points. The clustering was based on the mu sigma nu parameters. Basically, we thought, okay, it's micro local climates. But what we could see was the same, in fact. So when we took the most extreme opposed clusters in terms of mu sigma nu parameters, one in February, where the mu coefficient is supposed globally to be the lower, and the other extreme cluster in June, so the red curve, where mu parameter is supposed to be the higher, and so we could observe some difference in the curves fitted by the gamels, and that were quite following the observation. But when we fitted the same curves on a given month and not different months, we didn't observe any difference. So while we investigated a bit the parameter space, so just for the nice colors that I show it, and maybe for some use later, but I don't have any conclusion now. But what we did as an experiment to understand why there was no noticeable spatial difference in the EGPD marginal distribution in this case study, what is it because of the low amount of data or because the GAM form for the GPD fails at capturing the spatial difference? So we here we plot again for the 3 stations of interest the histogram of data over the 3 years for different time period. So months January to March, April, May, and so on. And then we compare for each of this period or months, and for each station of interest, the fit in the GAM within the whole GAML's fit as we've done before. So when we take into account space and time covariates, and the fit when we don't take into account space and time covariates, that is, we just fit at a given station and then repeat it for another station. And I hope you can see it large enough. So these are the results for 4 months, February, April, June, October. On the left, it's a special GAM fitting, so with spatial coordinates. And we see that we have no difference in the fit, in this fitted CDF for each month. While on the right, you have the no special GAM fit, and but we keep the months index, the months covariate. And then here we see, apart from April, we see, and even April, we see something. We see a clear difference and much more in agreement with the empirical data in the CDF fitted. So the conclusion was then that we have, in fact, not enough data to fit both space and time covariates, especially because, well, it's the second point I won't detail, but basically you have much more information to quantify a month than to quantify a station, to quantify the particular behavior of a station over these 3 years. And so this work can be continued with the same time of regression for over a larger period, like the years 1996 to 2021. We have less station in Brittany, but with a few key points, we can estimate maybe a trend in the extremes, because the interest of this EGPD distribution is that you have 3 parameters, and one controls the upper tail behavior. It's a shape parameter, and so either it's positive, close to 0 or 0 or negative, and then you have different behaviors in terms of extreme. When it's positive, you have a Pareto type distribution, so heavy tail. When it's 0, it's exponential, not heavy, and when it's below 0, it's bounded. So it's it means different things in terms of well, weather and risks for locally and so on, fast flooding and so on. And so, yeah, it's an interesting tool for global modeling of distribution with non-stationary tails, without considering only the extreme value modeling, because when you normally use extreme value analysis, you only focus on the tail, and the complex things is to coordinate both the small intermediate values, well, the bulk of the distribution plus the tail of the distribution. And this is a convenient mean to do it with very few parameters. And also, so I didn't describe it, but the mathematical reasoning to come up to this distribution was interesting, but you can read more in the paper if you are interested. And so, yeah, that's it. Thank you for your attention. If you have any question, I hope you heard me. I don't hear anything. I'm not sure.
It was okay. I could hear you, Noemi.
So I don't. Is it working?
Yeah, I heard the whole talk.
Apologies, we were muted. We all gave you a round of applause. Sorry, guys. We'll give you another round.
I don't see anything, so I don't know where.
Well, we were talking, but with our masks on, it probably looks like nothing's happening. We were just watching. Yeah, I'm just saying thank you for your wonderful talk. And Dominic has a question for you.
So Nate, so the penalizing spline that you used in the fitting, I guess, of the spatial model.
Yeah.
Yeah, is that So is that built, are you regressing onto the quantities of interest, like the precipitation or whatever it is, or are you regressing on some kind of dependence between the stations?
So the quantity of interest is precipitation, and I'm regressing over covariates like space, latitude, longitude. It could be altitude, for instance, in mountainous areas. Also time, so months, year, depending on what, if I want to assess the cyclic thing, or if I want to assess a long-term trend or long-term cycles over years.
But you can do spatial interpolations as well.
Yeah. There are many possibilities. I just use the simple one, like the smoothest functions, like just a penalized spline. So I don't have to enter manually the degree of freedom. That's why it's called penalized, because it's well, no, sorry. But basically, it's the degree of freedom is calculated automatically within gammels.
Do you miss it? Do you miss us?
Yes, of course.
Yeah, we
That's
miss
why I'm here.
Thank you so much for finding the time to be able to give a talk despite your other studies and the work that you're doing. So thank you so much. Do we have any more questions from the audience on Naomi's work, or from the Zoom call at all? And if not, then thank you so much, Naomi. I wish that we could have you for lunch in person, but I hope we get a chance to see you soon.
See you. Ciao.
Thank you, Naomi. So next up, we have Diego talking to us on Creedal networks for risk and resilience assessment of complex safety systems subject to severe accidents. So Diego, great to see you. If you'd like to start sharing your screen.
Yes. Let me just find my window. You should be able to see it now, I think.
Yeah,
just
going to put you on spotlight before we begin. Bear with me. Okay. Yeah, we can see and hear you okay, and we can see the slides.
All right. Okay, thank you very much for having me here today. I really miss being there, actually. It's really good to be here. So I will talk about some of my work that I did throughout my PhD in the Risk Institute. So I'll start by defining what is a complex engineering system. Basically, it's any arrangement that has a huge number of components that are operating and interacted between each other. Usually, they include both human and non-human elements. So this can be from nuclear power plants to dams. Sorry, to dams, or to any also the area control rooms. Apologies. Sorry. Yeah, so these kind of facilities. There is a need for decision-making tools that take into account the randomness of potential threats to these kind of facilities, to model the accuracy and the increasing complexity of highly interconnected systems. That takes into account the human and organizational factors, the variability on time of system performance, and the epistemic uncertainty. There are certain techniques in the literature that are very well known to represent dependability. For example, the fault tree or event trees, also Bayesian networks or survival signature or Petri nets. However, there are some key points that are missing there, and that's one of the questions of my research was how to address the epistemic uncertainty that is due to the indeterminacy of ambiguity or fragmentary or dubious information
another phenomena that would not support the analyst in informing or a subjective opinion in terms of probabilities. So this can be due to the lack of knowledge or poor data, also linguistic expressions that are coming from the experts, contradictory information, or differences between expert judgments. So we want to adopt this approach to avoid hard assumptions or excessive simplifications of the models in terms of the when we take in the information, and also some over or underestimated outcomes. So the technique that we are proposing to use is one called Cradle networks, which is a Cradle network is a probabilistic graphical model that allows us to study the genuine dependencies of uncertain and imprecise parameters. So it requires nodes that represent the events in our system, and arcs or edges that represent the dependencies between those events. And we model those events by giving probabilities intervals. So for example, we say, what is the probability of an event A happening? So it's going to be between 0.5 and 0.25 and 0.5. So with this kind of models, we can do prognostic or diagnostic analysis. And for that, we need certain algorithms. One of them is, well, basically we need to compute the posterior probability of our events. And we do that by using the likelihood function and the evidence that we have of the events that we have. So in Cradle networks, computing the posterior probability requires computing two values that correspond to the minimum or the lower bound, and the maximum or the upper bound that correspond to the maximum posterior probability that can be found over a combination of probability values inside the likelihood function and the evidence. So what are the computational difficulties on working with these kind of models? Well, is that the computational time escalates exponentially with the number of variables. That means that the more variables or more connections we have, the harder is to compute our posterior probability. So also the inference in Cradle networks is a multilinear problem, and also an NP complete if the network is tree-like shaped. So, and also when or is even more complex when we have general networks. And also when we want to take into account the time dependency, the complexity of our problems increases quite a lot. I will explain this later on. So there are a number of inference algorithms that can be used. The most common is variable elimination, which is, it allows us to compute exactly what is the posterior probability given a set of random variables, but it's quite expensive. So we wanted to propose a method that would allows us to compute this kind of posterior probabilities. Depending on the algorithm that we use, we can compute what is called exact bounds, or these are obtained with exact methods. So basically, is the bound that we're going to find mathematically, analytically, and then we have approximated bounds, which can be by computing an inner approximation or an outer approximation. The inner approximation is going to be contained inside the exact bound or the real bound, and then the outer approximation will be containing both the exact bounds and also the inner bounds. So we are proposing the use of the so-called method pseudo networks. So a pseudo network is a particular combination of upper and lower bounds of the intervals in the original Cradle network. This method works with multiply connected polytrees, multi-state and binary variables. It is exact whenever it is inserted, and is recommended when we want to prioritize the time over the precision, because this method gives us approximate results, and sometimes it can produce large overestimations. So the way it works is basically, so we suppose we have a network with three variables, and then what we want to do is choose the combination of bounds that will allow us to give us the minimum posterior probability. And also we do that for the maximum posterior probability. So we can do an outer approximation, calculate an outer approximation when we choose only the lower bounds of all the variables that are in our network, and with that we can compute our posterior probability given a normalization variable. So in this example here, we can see that, this is, so to compute the lower bound of our variable A1, we can use we will only use the lower bounds of all the rest of the variables in our system. In the case of using only binary variables, we can compute the one bound, for example, the lower bound, and then compute the other one by just using the complement rule. And this is useful to save some time when in the computation of the bounds. Then we can compute also the inner approximation using pseudo networks, and that is by analyzing different types of combinations of lower and upper bounds of the states of the variables. And with that, we could compute, after analyzing a number of combinations, we end up with our maximum and our minimum posterior probabilities. And this approach can be used for multi-state variables as well. We extended this approach to dynamic Cradle networks. So basically, in a dynamic network, what we have is that we assign, we have one network per time slice. That means that every unit of time, we will have a Cradle network that will be changing so the parameters of each of these networks will be changing over time. So we tested these methods, one in kind of a toy example. So this is Cradle network that is used for fire risk assessment. Basically, we want to compute the probability of having a fire, given that we know that, for example, there is a smoke or the alarm went off. So given some parameters, we wanted to see what was the probability of having a fire. So we use some synthetic interval probabilities to kind of to build our model, and then we query the model. So here, for example, we can see that. So here are the probability bounds, basically, when for each of the variables queried. So in the x-axis, we can see that there is a variable smoke being true, or report being true, alarm being true, or the leaving being true. And here we have the probability bounds of fire being true. the blue band means that that is the inner approximation. The red one is the exact bound, and the green one is the outer approximation. We can see here that when we insert evidence in the network, so saying that we know that the fire is true, the outer approximation increases quite a lot. And I mean, this is something that we notice with this method. Okay, moving on, and we also wanted to test this method with time-dependent systems. So we used the dynamic Cradle network to assess the performance of a cooling system of a nuclear reactor. So basically, we were assessing the resilience of this nuclear reactor. So taking into account different factors, some of them were the human operators that are involved in the system repair. So to model the probability of success of the operator, so to model the success of an operator recovering a component that failed inside our system, we use this human cognitive reliability model. So basically, this gives us the probability of the human operator successfully finishing the task, giving a time limit, based in cognitive processing factors such as skill, rule, and knowledge. And this this model is adjusted by median time to complete the task, which is taking, so this median time to complete the task takes into account the coefficients for operator experience, the stress level, or quality of the human-machine interface. So,
sorry, can I just ask you to wrap up in the next couple of minutes?
Yeah, sure, yes. So very quickly, we assess, so basically we said, okay, what happens if one component in the cooling system of the reactor fails? How the operators will react to recover it. So we built our network, and then we say, okay, we saw the disruption, and then we say, okay, the operator takes certain amount of time and then to recover it. We tested different configurations of the conditions of the operators, like them being aware or not, or giving good human-machine interface conditions. And we produced these results. So in conclusions, I would say that the Cradle networks proved to be useful for decision-making on their epistemic uncertainty, capture the complexity of the system, and the graphical representation is useful for the ease of understanding. Also, they give us a flexibility for querying variables of interest, and there are efficient methods to that. So if we have efficient methods to compute the inference, we can produce fast results. And yeah, pretty much that is it. Thank you very much.
Thank you very much, David. Thank you. Wonderful talk. Do we have time for maybe 1 or 2 questions? Does anyone have any questions for Diego or from the Zoom call?
Diego, do you miss us?
Yeah, a lot.
Yeah, we miss you too, buddy. Any questions regarding his presentation at all? And if not, thank you very much, Diego. Hopefully we'll get a chance to see you soon, but thank you for making the time to get in touch and to present your work.
Thank you for having me.
Thank you very much.
See you in Dublin.
So before we wrap up, and we've got our booking for Pen Factory at 2 o'clock, so we'll try and keep it short. thank you so much, everyone, for presenting your work and for everyone that attended and your questions. I'd just like to ask you to basically fill out the sheets underneath your seats to write down your first and second choice for your favorite speakers. I've got a couple of pens over here. You can pass around, that's probably not enough. Anyone's got spares, that would be great. And that will help us award the best prize speaker, which will be a prize of £1,000 for kind of.
Can we see the list of speakers?
Yeah, exactly, no problem.
It's been a long time since I've sat in a room with so many people.
I know.
Can't remember who's here.
So those were the speakers and their titles. And if Scott, in the meantime, do you want to make any closing remarks?
I do actually.
Please.
So obviously you saw the talks, they're really quite impressive. I think. Diversity and scholarly depth. It's a credit to the Risk Institute, really. Michael Beer and Ken Badcock and John Morrison and I can take the credit for it, but we bask in the shade that you've created. We're actually amazed by your contributions and also by the intellectual rigor, the work ethic that you use to make them. You're alumni of the Risk Institute, and I hope that you'll keep in touch. We're a small community in a big world, and if not out of sentimentality, at least out of a sense of professional networking, I hope that you'll keep us up to date on where you go and what you're up to. If you send a little email to Tom Wilkinson or Andrea Jones, you can actually update the Risk Institute bio sketch we have of each of you. I know not all of you have your pictures there, but I don't know who you are, but if you don't have a picture there. But you can update us with a new picture if you like, or at least your affiliation where we can find. In fact, we have an email forwarding service. If you tell us what your email is, we can, any email that's sent to your name at riskinstitute.uk will eventually get you wherever you land in the world. So it would be quite convenient. You can also put stuff on there like, you know, what your current project is or where you are, married or something outrageous. It's up to date, not too personal, LinkedIn website, you know, that sort of thing. I think that's all I want to say. Other than well, that's available to students and staff, postdocs and friends and hangers on. So we like to sort of know where everybody is, because you know, eventually you're going to think, oh, you really need to contact so and so, and you don't know where they are. So send your updates to Tom or to Andrea, and we'll update them on the website. So obviously we need a big thanks and perhaps a round of applause for Francis, who's organized this whole thing. And I guess it's time for
Yeah, I think we should head over, and I'll meet you guys down. Just gonna go from top here, but yeah, I think we've got around 20 minutes to get over that. Thank you very much.
exactly right.
Francis, thank you. Nice one. Hey.
Where are you going for lunch?
Factory.
Nice. Yeah. Send pictures.
Yeah, thank you very much, everyone. And we'll upload the talks onto YouTube soon, but thank you all for attending. And there's a bunch of comments as well that I'll save. All right, thank you, everyone.
Bye.